Доброго ранку.
Good morning, ladies and gentlemen. Hello. So let's applaud to each other. We are at the Mental Health Forum, and I think that when you applaud, it really supports our mental health. So, hello everyone. It's so good to see you. I want to thank you right away. I was observing how all of you were getting together, so inspired. You have shining eyes, and it's nice. Timur Miroshnichenko is here. Good to be here with you. It's so nice to see a lot of familiar and new faces. So welcome, and we'll start. So good morning. Good morning again. So, this is the third forum of mental health, and we are opening it. So, this is the third time, and this is a fantastic tradition when we get together every autumn. Well, first of all, to see each other, exchange opinions, and as they say, to synchronize ourselves, to understand if we're going the right direction, to correct something if needed, and to identify our next steps in mental health. And of course, to give each other the charge of energy, support, and inspiration. Because without that, it's very difficult to move forward. So, the topic of support is going to be cross-cutting today because this year's forum is named to support those supporting everyone. I mean, all of you. The potential and well-being of mental health workers, this is the main topic of our forum, and we will have really fruitful dialogue and we will exchange the warmth of this support, which is highly important. But for the start, a few organizational points. Safety. What to do if we have the air raid siren? We're in the bomb shelter, we're on the minus first floor. So, well, in general, we're safe and sound. And for those who are here online with us, I know that a lot of people are connected online. Please make sure that you're also safe and stay in touch with us. And of course, no matter what, everything goes on. So we want to express our enormous gratitude to our defenders. We want to thank those who are here in this room today. We want to thank those who are at the front line and they defend us and they fight for our independence and the future and the freedom of our country. Let's applaud. For sure, we want to thank those who are alive, those who are injured and demobilized. So let's take a moment of silence to commemorate those who died. Thank you. Glory to Ukraine. Glory to heroes. So, a few more words briefly about the agenda. Today, this is the first day dedicated to strategic directions in mental health and the implementation of all Ukrainian mental health program initiated by First Lady of Ukraine, Olena Zelenska. Within the event today, we will hear the data from a lot of researchers. We will speak about the workers in mental health and will outline the response strategies to the needs. Right away, let me announce the second day. That'll be tomorrow. And we will have the exhibition or marketplace format tomorrow, and you'll have a chance to see how different mental health service providers and coordinators of all Ukrainian mental health program working in 24 regions of Ukraine and Kyiv, how all of them work and jointly build the multidimensional mental health system in Ukraine. And also you'll have a chance to hear a lot of lectures and to see a lot of photos named photo exhibitions like the Touches of Support. That's the name of that. So let's start today from the welcoming words. The video from the General Director of the World Health Organization, Dr. Tedros Ghebreyesus.
Honorable Minister Dr. Victor Liashko, Excellencies, Ambassadors, dear colleagues and friends, welcome to the 3rd Ukraine Mental Health Forum. And I thank Her Excellency, the First Lady, for her leadership on mental health and for establishing the All-Ukrainian Mental Health Program. Ukraine's experience has informed global policy, including the World Health Assembly resolution on mental health and psychosocial support in emergencies. I visited Ukraine in the early days of the war and saw firsthand the commitment and resilience of health workers. At the same time, the extreme circumstances in which they're working must never become something we accept, and they're not a burden they should have to carry alone. We must ensure that mental health workers are themselves supported. This is not only a moral imperative, but a foundation for building efficient and resilient mental health services. WHO is committed to supporting Ukraine to empower mental health workers with the best knowledge and practices. I thank each of you for your work to respond to the needs of today and the foundation for a healthy and peaceful future. Because there is no health without mental health. Дякую.
Let's thank as well to Mr. Ghebreyesus. Remotely thank, why not? Next year it would be great to see him personally on the 4th Forum of Mental Health. So the system of mental health for sure is the multisectoral and multidimensional. At the same time, the healthcare sector has the key role in building the national policy on well-being and health of the population. And also, the person gets the support from the preservation of health and well-being all the way up to the specialized care when it's needed. So what is the vision of the Ministry of Health of Ukraine in the area of the development of system and services of mental health and the preservation of the well-being of healthcare workers and other mental health service providers? We'll learn about it right now. Ihor Kuzin, Deputy Minister of Health, the Chief State Sanitary Doctor of Ukraine. The floor is yours. Good morning, colleagues. Is there a clicker? First of all, I want to thank the organizers. It's a great honor for me on behalf of the Ministry of Health to say these welcoming words on the 3rd traditional forum where we're not just summing up everything that's been done, but also we're discussing the main points and how all of us we need to exchange opinions or maybe take into account other challenges related to mental health. I will touch base in my presentation the block that's related to the healthcare. Why is it so important? In the context of service providers, mental health service providers, healthcare workers are probably the biggest group of service providers providing such services. So here you can see the total number of healthcare workers, 128,000 and 215,000 of mid-level healthcare workers. These numbers are huge, and we understand that almost 70% of the packages of program of medical guarantees, they all have the component of mental health. But what is the mental health condition of the healthcare workers themselves? Of course, Some international researchers provide the answers, and one of the latest research of the World Health Organization says that after the COVID pandemics, almost 50% of the healthcare workers feel burnout, 3 out of 10 feel anxiety, 3 out of 10 also feel depression, and 2 out of 10 feel PTSD. And what number we will have after the military actions, after the work in pre-frontline territories, it's so difficult to forecast that, but for sure we will see the deterioration of such situation. What is the number of service providers in the healthcare system? As of today, 2.2 thousand primary healthcare facilities provide psychosocial support. 150 mental health centers have been already opened, and at the very least 90.5 thousand patients received the necessary services, and the number of services is reaching 200,000. 135 providers of psychiatric inpatient care and more than 70,000 services are provided. Of course, here we can see huge number of service providers and services in the area of mental health services. So what is the biggest group? For sure, these are the primary healthcare workers, doctors, the ones who face the patients first. They see the families all the time. And for sure, more than 16,000 primary healthcare doctors provide mental health services these days. It's important to say that actually, thanks to the flagship program of the World Health Organization, MHGAP, we've managed to train the necessary specialists and also to ensure that they are prepared on the high level. I will not tell you about the main numbers here, but I think you all know them, that more than 160,000 people registered for the MHGAP training, and 105,000 people finished MHGAP training and got the certificates. 105,000 on the second level, and more than 138,000 received the first level MHGAP certificates. As of today, probably this is one of the few training programs in the NHSU Academy that is in high demand, highly popular, and it is so nice for me to say that the defense forces and army of Ukraine, they also join this course because they understand how important it is, how beneficial and helpful it is, and the standardized practices may be so helpful. So what are the most frequent requests of patients to family doctors or GPs? It will change by numbers, but anxiety, tension is probably the priority on the list. Sleep problems, likewise mental health symptoms or other complaints, child behavior or depressed mood. These are top 5 requests that people come with to GPs or family doctors related to mental health. In 2024, thanks to the support of the World Health Organization, and we all say that it is the well-being of healthcare workers. So in 2024 and 2025, the program for stress management for healthcare workers was implemented because the healthcare workers providing such services face burnout more often. So 5 cities of the region were included, and it started from primary health care, and then it covered specialized care. Thanks to this specialized intervention, we've managed to reduce by 22% the depression level, by 26% reduce the post-traumatic stress, and by 10% the anxiety level among healthcare workers. The results of this standardized trial and test really proved to be effective, and they became the foundation of the methodological recommendations approved by MOH in June 2025. And these methodological recommendations, they are also greatly impacting the enforcement of the mental health law, because there is a special article that at workplaces, the head of the facility, any facility, can create psychosocial support programs for the employees. That is so important, and all of us as employers have to take care of that so that our teams would be as stable as possible in mental health area. The latest World Bank research shows that 61% of primary healthcare workers say that they use burnout prevention programs. And it really reflects how much we perceive the burnout programs, because it includes all the interventions, the availability of psychological relaxation rooms, additional day off, team building activities, but the level of use of such services is very low. Only 24% of people say that they actually use these services. And in general, it means that the stigmatization level of mental health, the level of distrust to these services among the healthcare workers, unfortunately, is still on the high level. Mental health centers, they are the main ones in the area of the all-Ukrainian mental health program initiated by First Lady of Ukraine, and they will for sure fulfill their foundational role. As of today, 60% of mental health centers were opened in the cluster hospitals, and we can see the plans on opening such mental health centers in all the regions, and we hope that all the regions by the end of the year will open the necessary number of mental health centers. Right now, we plan to have 166 centers, and as of today, 99 mental health centers were opened in the cluster hospitals. But if we calculate the total number, then it is way higher. So what are the main requests in mental health centers? So this is suspicion for mental health problems, severe psychiatric problems and paranoid schizophrenia, something that's related to nervousness and anxiety or depression. These are top 5 conditions that are worked on in mental health centers. And the last block I'd like to tell you about to show the infrastructure that we have in the healthcare sector, that is the inpatient psychiatric care. 135 hospitals provide this type of services, and 87 of them are in the capacity network. So here it's important to say that as the Ministry of Health, we also see and know our priorities for next year. For 2026, we plan to revise the component related to the treatment of addictions or substance use disorder. So this is the problem that is getting more and more relevant because of the number of appointments and the number of persons with substance use disorders is going up, and that is a very, very big problem that requires standardized and long-term interventions. We continue working to step back from the old Soviet approach in the area of psychiatric care, and here we're speaking about the fact that child psychiatric units have to be taken away from the inpatient hospitals, and we also work on deinstitutionalizing psychiatric care. And here it's so important to mention the joint initiative with the UNICEF, which made it possible to have specific training activities for the specialists in psychiatry who help Ukrainians in all the regions of Ukraine. And for sure, in the inpatient treatment, we can actually see the dynamics or top conditions which require inpatient treatment, that is adaptation disorders, personality disorders, or conditions related to the treatment of PTSD. Likewise, different mixed anxiety disorders, and the block that's about addictions or substance use disorders. Right now it's on the 5th place, but for sure we do hope that due to standardization of the medical care and healthcare provision and the improvement of diagnostics, we'll be able to see higher percentage of resocialized patients who return into the communities.
Therefore, thank you to every medic, to every international partner that are helping us to move forward. And then also, my gratitude goes to the defenders of Ukraine. And also, just like to mention that from the Ministry of Health's side, we will do everything in our power and everything depends on us so that the part on the provision of mental health services in healthcare system would be standardized, would be as much of a high quality as possible, as accessible as possible for the needs of communities, for the needs of Ukrainians that will be going on. Thank you so much. And we are grateful to you, Ihor. And so we are moving forward. WHO and are providing support to Ukraine for the development of a health system overall and also for the mental health system altogether. And this technical support, this expert support, plays a key role for the transformation that are happening in the country, would be in line with the top international practices. How are you assessing the progress and the build-up of the mental health system in Ukraine as an answer to the growing demand from the population, from the services providers, and how does WHO see the key priorities in mental health in Ukraine? So right now we will be able to hear answers to these questions. I welcome the WHO representative in Ukraine, Jarno Kavik.
Доброго ранку, good morning for everybody in this room, as well those who are connected online. I will give a second if you need any translation, interpretation devices. But overall, Your Excellencies, partners, colleagues, friends, it is good to see that we have now gathering, and that we are gathering now on the 3rd Mental Health Forum. We discussed about mental health at the time of COVID, since the full-scale invasion on 24th of February 2022 and the full-scale war. And I like to thank, first of all of you for your energy that you are putting to mental health. I see, thank you, Ihor, giving us the overview where we are going. Oksana will talk later on what has happened. We don't have this energy in the room without Irina. I could go every of you, and you're making the difference. You're making the difference for millions, and Ihor showed us many of those numbers. But let me add some of the information from my side. And I would like to look to the 3 aspects. One is transforming the mental health services. And today's conference and the meeting today and tomorrow in particularly looks to the intersectorial aspects of mental health, while Ihor was talking about what is happening within the health sector, and then Oksana will expand a lot what I'm telling later on. Second, a little bit more on resilience and recovery and what role the mental health has there. I would like to use this opportunity today also to reflect slightly of the work of the WHO in the area of mental health, and that is there to get us to think what more needs to be done. And then, as Dr. Tedros was mentioning, a bit more about mental health workforce and how we look into that topic in particular. So over the past decades, when I look at WHO's work, we have constantly developed different tools, methods, and that's the role of the WHO. And what is important is tools and methods have got to the practice in Ukraine. And I think that I like to thank all of you, because you have made that possible, that the tools are getting to practice. And we have done pilots, what Ihor was mentioning now, on the Self-Help Plus in Dnipro region. But if we go back, what we learned in other regions in Donetsk Oblast since 2014, we have been doing testing and trying out what works for people in Ukraine over many years. And I like to thank you for that, because that normative documents that WHO is preparing, and my colleague Fami will talk more about them as well later on, are getting to practice. And that is how we transform the health system, but across all the sectors as well. What is important also is that Ukraine shares the experience further. It is because of you, because of the leadership of Olena Zelenska and the experience that Ukraine has, you have spearheaded together with Kingdom of Netherlands the global resolution on mental health. And important enough is that to say that mental health needs to be priority in any emergency. It is because of you and your lessons you have changed that narrative also globally, and I like to thank for that. So that's how we are looking to how evidence is getting to practice. You are testing it, and you are feeding and changing the global narrative as well. And that's an important, and that's a resilience of you and Ukrainians, and we should not forget that as we go ahead. Second, about resilience and people, and sometimes we talk about human capital when we meet in the Ukraine recovery conferences. I think since the full-scale war, and as also Dr. Tedros has said, we need to ensure that we take care of the mental health of those who are supporting others, and at the same time priority mental health as well for everybody. And we developed the systems for across the whole country, and we ensure that the system and these are equitably accessible everywhere. And Ihor was showing about mental health centers, talking about primary care. We saw how these different centers are available in different oblasts. When we meet next year, I hope we can see green light everywhere, because this is how we support Ukrainians across the whole country. But also, what we can do is to ask, how are you, from each other, and ask that question from those who are actually supporting others. And that's extremely important that we do that, because we know that every year we have less and less healthcare workers, at least what I see among the nurses and doctors. We know that we have gaps among healthcare workers, especially in the eastern oblasts, where the needs are the biggest, and we need to ensure that they are supported enough. And this is exactly what I have seen being in Zaporizhia or Kharkiv or any other oblast, what I have been visiting in the past years, to talk how we can support the mental health professionals to be available, and how we can support, because they are working in a very difficult situation when they see the homes, the children, the elderly, and how to support them. And what they see, and you see actually, many of you are doing that job here in the room or those who are connected, how we can support you more. And I think that is extremely important that we do that. But we have some light at the end of the tunnel, and Ihor showed that experience that we have had, actually scaling up the Self-Help Plus tool in few oblasts, among few professionals. Actually, these are quite many. And we see results. So we now know the tools, what actually can work and support the healthcare workers. But not only inside of the health sector, where that pilot was done, but actually we can use it across many sectors. And we have been discussing that with the First Lady's team and with Oksana, how we can do more of that across all the sectors, because that helps in the private sector, public sector, in the smaller villages, in libraries, in schools, in many places, and that makes the difference. And finally, why we need to do that, and my colleague Denise will talk more about that, is the situation in Ukraine is becoming more difficult. Because what we see in last surveys is that 39% of Ukrainians are experiencing mental health issues and feel that it is difficult to maintain the normal activities. So I think there is a need which is growing, and I think we need to be more resilient to address that need. Because the war is not over, and even when there is a day after, the mental health needs are not disappearing, and we need to address them. So in this context, what we have been doing as a WHO in the past years, and of course this is not the full summary, but I think I like to highlight some of the aspects. We have been working together on developing the vision to mental health. We have been working days and nights with our team led by Alisa and then the colleagues, sitting together thinking where to go. But it needs to be a Ukrainian model, so I thank all of you also for doing that together. I think we have established together the multi-sectorial coordination, which many countries are now coming to look at. You did so many visits in the last years. You said, this is what we want to learn from Dutch. This is what we want to learn from Japan. This is what we're learning from Belgium. This is something useful for us from Canada. But you have developed your own system which works in hromadas, in villages, in oblasts, and that's an important. Please keep it, because it's not easy and it is actually quite unique. We have been working so much on building capacity across the whole country, and Ihor showed some of the numbers. We have also coordinated the partners, and I will say some of the numbers a little bit later, but many of you are also in this room, and there are hundreds of partners working on mental health. And I think that coordination is extremely important because we don't want to do harm as we support people. We will continue to work with the Ministry of Health, with the Ministry of Social Policy, but actually across many of the sectors and as war goes on and also after the war. And in this place, I would like to thank also those who are providing resources. We see some of the emblems here behind me, but I like to thank today particularly Canada, the Kingdom of Netherlands, as well France, because they have made possible us to meet regularly and work together. In the health sector particularly, together with Canada, they have supported the MHCAP program really to be scaled up. And that has made possible to train more than 135,000 healthcare workers. Ihor showed the number. If you remember his slide number, I think 5, it was 138,000. And we are continuously doing those trainings online and in person. We need to scale up in person. With the support of France, we are working on building those capacities in those mental health centers Ihor was mentioning as well. But also across the sectors, we have been working from WHO's side, supporting the resilience centers across all 24 oblasts and in hromadas to train more than 500 people on various mental health tools. But also we are working with universities, we've worked with penitentiary system in 24 oblasts. So we see that the tools which are available and these flagships, they are possible to scale up in the different sectors. Our only challenge today, we should do more of this. And we should support those who are working on mental health across the Ukraine. And I'd like to thank also the Kingdom of Netherlands because they have been supporting the coordination center and Oksana's team through WHO that we can actually come regularly together. Because in most of the countries in the peacetime, it is difficult to get all of you to the same room. In most of the countries in the wartime, this is not happening. And that is important that we are coming together, we share, and we also think how to go further. And Oksana will tell us more about the latest developments later on. And finally, on the coordination, I like to thank partners. Together with IMC, we are coordinating the MHCAP technical working group, where we have had over the time more than 400 partners. And there has been one important trend when I'm looking back to 2022 and comparing it to 2025. In 2022, among those partners who were together, 28%, literally every third partner, was a local partner, was a national institution, NGO. Now it is every second. So that means that over these years, we have also seen the growth of Ukrainian partners, which in the humanitarian terms we call localization. But for me, that shows resilience and that you have energy to carry on and to do more in the area of mental health. So in conclusion, I really like to welcome you all to this room, to use today and tomorrow to think, but ask from each other, how are you as well? And think how you can support each other. I know from my own team, many of the colleagues, that this support and even talk in the corridor is extremely important because everybody matters. You can be a teacher, you can be a parent, you can be a friend, your friends could be children or elderly, and you need to support each other. And I think that's the only way how we can go through this war and to build resilience also for the future and think about the recovery. So we have the knowledge, tools. We need to support those who are working in the health sector and beyond the health sector, that they can do their work. And I wish you a lot of strength, energy, resilience. Slava Ukraini!
Дякуємо надзвичайно.
Thank you so much, Jarno. And Jarno have just mentioned that from 2022, the All Ukrainian Program for Mental Health, How Are You, or TEYAK, was initiated by the First Lady of Ukraine, Olena Zelenska. And this massive and all-encompassing initiative is not just the answer to the urgent needs of military time. This is the whole ecosystem where different sectors and stakeholders have merged efforts so that we can increase the awareness on mental health, to get the help closer to the person, and to lay down the grounds for many years to come for the future. A long way has been passed, and its results and achievement will be told by Oksana Zbitneva, head of Coordination Center on Mental Health of Cabinet Ministers of Ukraine, the head of the NGO Barrier Free, or Bezbariernis. Oksana, we welcome you to the floor. Give me more applause. Dear colleagues, dear friends, dear partners, so co-creators and co-actors. So those of us who are in the hall, those of us who are offline, and those of us who have joined in Zoom or in other platforms throughout Ukraine, I welcome you here. The How Are You program welcomes you all. Our dearest of friends and our biggest family of How Are You. And we, with the Andrei Kostikov that beheads the service of Ukraine, we were talking before, and he has shared with his feelings and then how strong the changes can be felt. This third forum, but as a new tradition. And with every single year that comes, we have more and more worms. The worms inside, and hugs as well. This means actually that we are creating strong horizontal connections. People, experts, are getting to know each other. And so we are growing in depth in what we do when we are doing it with love. Therefore, I wish you all and gratitude, and I thank you all with my gratitude. Okay, let's go. I don't know about the achievements, but I would tell you about the overall sums. Because changing the optics, we are sometimes focusing on some separate actions, and so we are forgetting to do the reflection on what kind of path has been passed so far. And today we would just like to say that the program of How Are You, this is about what was not present and now it exists. And if you're in the retrospective for 3 or more years would look back, you'll be able to assess what kind of changes had happened. And the most important that changed in this 3 or more years is the understanding that the care for mental health have to be covered not just by the vulnerable groups, but every one of us. And as the First Lady of Ukraine has mentioned, that the care is finally outside of the doctor's room and become closer to a regular life. And this is critically important because we are not speaking about the target group that's really narrow, but there is an understanding that everybody has their own story, because we all of us who has the experience of war. And just think of that, this is the story about 33% of our veterans and 47% of their family members that are learning to live again. This is about more than 3 million of women of reproductive age that are given new life in conditions of war with anxiety. This is about 2 million people that we as adults have to give them resilient and possible future. Not a generation of children of war, but a generation that learn to be resilient, that learn to be good. This is more than 9 million people that left their homes and then they are fighting with mental health disorder. This is the 6 millions of Ukrainians for whom the barriers of war has become a double burden, and half of them report about psychosocial problems. That's 9 million of our seniors of advanced age population, 80% of whom experience anxiety, and more than half of whom are all alone. This is 4.1 million people who have survived the occupation and in need of our support to recover. And all of those figures are testifying the collective trauma that How Are You program and to transform into collective growth. And this required the new logic. All Ukrainian program How Are You has become the umbrella that merges sectors around the needs of every single person and helping the system to see and hear them holistically. And this is a huge paradigm shift. Here is the architecture of this new logic. It's a living ecosystem that brings together the state, non-government sector, business and science and community all around the individuals. And the question that needs to be answered was, how can we make mental health care accessible to millions? And the answer was in the integration instead of isolation. To take services outside of the buildings and to build them into everyday's lives of every person. And this is how it changed the landscape. There was a fundamental rethinking of what social services are. A new government service for building resilience was created and funded by the state budget on resilience. This is a departure from the narrow focus of working just with people in the difficult life circumstances to a broader prevention support available to everyone who wants to strengthen their resilience. 326 resilience centers. This is the infrastructure of this new philosophy that already has 1,500 specialists in its network. Mental health has emerged from isolation even within the healthcare itself. And Ihor has confirmed that for me. Can you say okay and good? It's no longer a closed sphere of psychiatric hospital, but a service integrated into the primary care structure in 2,170 institutions, and the help is provided close to home, close to a person in 150, because they had a different number before. And I have changed it, Ihor, and mental health centers 150, not 114. And another fundamental shift to near 5,000 mental health professionals that are present in the healthcare. There's also joined by primary care provider, which is almost 23,000 doctors who have taken an important psychoeducational screening and supportive function. And by merging mental health and physical health as the one whole thing. The same logic of integration has formed the basis for support in security and defense forces. For example, in the Ministry of Internal Affairs system, care for personnel has become a standard of service and not just as response to trauma. This is the full cycle support from the selection and training to rehabilitation, and this cycle has been provided by over 1,000 specialists in every department that they have. The program covers not only employees but also their family members. And the most important one, How Are You program, has gained allies in most unexpected places. Libraries, active parks, free legal aid, employment centers, museums, theaters, and the veteran spaces, youth centers and veterans theater, art schools, and art spaces. Today, the How Are You program has mapped 13,000 services providers in different sectors. Thus, the new geography of care has been created. But the having entry point is only half the battle. Who provides those services? The second fundamental shift was concerned the expansion of personnel of solution. The system has faced the shortage of personnel and the lack of tools and instruments that would meet the new reality. It's not just enough to find a specialist, it's necessary to continuously invest in their development, their quality, and implementation of innovative, evidence-based approaches. This system has expanded the arsenal of profession, recognizing the experience as a professional resource. People who have experienced combat trauma or loss received certificated training in the National University named Dr. Shevchenko and Ukrainian Catholic University to become the peer-to-peer consultants or counselors. Interestingly, Ukrainian businesses are also investing in this. Peer-to-peer is not just about engagement. It's about the institutionalization of a new profession with the plans to include them into the job classifier and further integration of social medical services. New models are being piloted. A proactive approach is being used in Uman City. The system doesn't wait for the people to reach out, but comes to them first. This is an outreach line support for women who are pregnant, and based on the proven Japanese experience in education, the focus is shifting from overcoming trauma so that we can scale this up for all of the Ukraine. In education, focus is shifting from overcoming trauma to fostering resilience. The lessons of happiness program is that they invest on the future generation, their emotional competence. This is not just to grow the generation of war, but to form a resilient generation that does not prohibit to feel happiness and goodness. And this is from what I know, a strong economic leverage. The How Are You program have involved with the Ministry of Education of Ukraine and 150 prepared trainers from time to time, but all over the country. We are conducting all Ukrainian lessons for mental health. The transformation will finally go to psychological system in schools. It's sort of we are lacking or waiting. It has to be all valued. So we are speaking about almost 12,000 psychologists and around 4,000 social pedagogues or teachers that will have a change in function and instruments of their work, and they will have the implemented of the basic intervention tools. How Are You has integrated the services into the community. New professions are being created and innovative approaches being created. But how can you manage all of this? This third and perhaps the most important shift is concerned with the very logic of management. It was necessary to move from reactive, chaotic processes to a mature, managed ecosystem that build on trust with the coordination mechanism and based on the evidence data. This system has learned to look at itself in a mirror and to make decisions based on data rather than assumptions. Comprehensive research system has been created ranging from annual population assessments to an audit of the regional needs, study of international experience, and assessment of institutional sustainability. This evidence base is becoming visible and accessible to citizens. For example, through a unified map of services providers on the How Are You program. That is the front end of our big analytical work. Service mapping is a tool that connects the people's needs with the verified services provider in their communities. And regional coordinators teams are the keepers of this living network of providers on the ground. The regional military administration, the coordinator of the How Are You program, and community level consultants of How Are You program. Services are mapped in each region, and more than 200 communities have already been have the guides. And this management mechanism gives you measurable result. 26 regional priority projects covering 2.7 million people in 709 communities or hermadas. This is a proof that the architecture of interaction is working, generating thousands of support measures in 10 key areas, from veteran policy to culture. And all of that leads to the final and the most important transformation from individual programs to state policy.
І нової суспільної культури. І ми бачимо докази цієї культурної зміни. Запит на інформацію про ментальне здоров'я зріс до 86%, а рівень
And the level of, categoric refusal to seek support has decreased twofold from 46% in 2022 up to 2022 in 2025. So the trust towards the system and the readiness to talk about their condition goes up. But trust is the most precious currency, and we will be working on it for a long time by our daily painstaking effort so that people know where to seek support and from whom, and also generating relevant and professional content for different audiences in different formats. It is a kind of knowledge base that can empower both those who are just beginning to learn about something about themselves and those who already have some experience in the field of mental health. And that's where we are today. All these shifts in access, staffing, and management have led to a logical result: the construction of a comprehensive architecture. This architecture is now enshrined in the law of Ukraine on the mental health care system. It is based on strategic vision, which is target model, and has been validated by the international scientific community, in particular the Lancet Commission. This architecture is not just unique, it fully complies with the best international standards of the EU, WHO, and the Organization for Economic Cooperation and Development. It is the practical embodiment of what the world is only strategizing: integration into all policies, transition to community care, and a cross-sectoral approach implemented in wartime conditions. You can read more about these shifts and this unique path in the document describing the experience of the all-Ukrainian mental health program. How are you? Is everything perfect? No. Have we learned to cope with everything? No. Do we know the answers to all the questions? No. But we are definitely asking these questions. And by laying the groundwork for these fundamental changes, How Are You was primarily aimed to develop a service infrastructure in various sectors without which it is impossible to solve truly complex issues: addiction, suicide, sleep disorders, grief, the effects of distress, PTSD, war trauma, because these are not issues for individual specialists, they are issues for the whole country. That is why the priorities of How Are You are not about expansion for the sake of quantity, but about strengthening quality, knowledge, infrastructure, science, training people, and the ability of the system to withstand the load. Only with a solid foundation can we move from responding to crisis to a real policy of human well-being. I want to thank each and every one of you in this room. Thank you, those present with us online, and will be reviewing our forum later. Thank you for supporting others despite these trying times, and for holding on yourself despite everything, because without you, without specialists and experts, scientists, analysts, managers, these changes, this new architecture would not be possible. Thank you. Thank you to the WHO for its courage in supporting systemic change, because there are no quick results here, but they are inevitable and you need to move forward. That is why, Yarna, the applause goes to you. We would like to thank all of our partners with whom we work together under the umbrella of How Are You? UNICEF, the International Organization for Migration, the International Medical Corps, and the Red Cross community in Ukraine, embassies of multiple countries. We will not deal with it on our own, but we are learning really quickly and we will also teach you. Thank you very much. Oksana, this applause goes to you. Oksana Zbitneva. Thank you very much. So, ladies and gentlemen, we are moving very smoothly to the second part of our forum, which will be about the overview of the recent research in the field of mental health, which lies in the foundation of the evidence-based solutions, because we understand that to respond to people's questions, we need to be fully aware of their needs, and during this section we will learn more about the set of different studies in order to better understand which direction the mental health system should move into. And I would like to give the floor to Mackenzie Simon, the head of the research unit, the RAGE initiative, who will present the multi-sector needs assessment in the frontline areas. So the floor is yours, Mackenzie Sibach.
Good after or good morning. I will give cues for when to change the slide. So yes, thank you everyone. Or perfect, even better. Thank you everyone for attending today, and also thank you for the invitation to present our research. Just to stay on time, I will try to keep it short, but we are going to present a brief overview on what project we will be discussing today, as well as some of the MHPSS data that we have gathered from our assessment. So, as a brief overview, the Multi-Sectoral Needs Assessment, also called the MSNA, is an annual research project that REACH Initiatives does in Ukraine every single year. It's predominantly meant to inform the humanitarian response and the prioritization in country. This year, because of the reprioritization from international humanitarian actors, we have done a research that focuses mostly on frontline areas. So what we're discussing today is around 2,800 surveys and can be considered to be representative. So that means what we will discuss is an overall snapshot of the country. To discuss the MHPSS concerns that we got from our assessment is, of course, incredibly relevant to discuss the needs in Ukraine overall. And what you can see is that the needs in Ukraine continue to be concentrated in frontline areas, but there are also needs that are widespread throughout the entire country. So you can see that conflict exposure is clearly driving a lot of the needs in Ukraine, as are income quantity, taking on debt, relying on coping strategies to cope with not enough money, housing concerns, and chronic health conditions, among others. Some of these concerns are what we would consider to be extreme, so immediately threatening the lives of individuals. So in particular, for example, in Donetsk, you see conflict exposure being a major concern, as well as there's drinking water quality challenges and unmet health needs. Much of these needs would be considered to be discrete. So that means when you have extreme needs, you're having extreme needs in one specific area of your life. So that means if you have extreme needs in housing, you are only having extreme needs in housing. Only about 6% of all households in Ukraine are having compound extreme needs. However, when looking at more severe needs, you are seeing that the needs are compounding over time. So you don't just have needs in housing, you're having needs, for example, in water quality, in access to education, etc. And what you can see here is a graphic depiction of the most common profile of needs we're seeing in the different areas of Ukraine. And it is predominantly related to livelihoods. So that means people's ability to make a living in dignity. Now, of course, all of this has a huge impact on the mental health of those living in Ukraine and living with the ongoing crisis. So overall, in our assessment, 63% of households reported having someone who felt emotionally unwell for a period of at least 2 weeks, which made daily life harder than usual. And what's really important is that we see a direct correlation between needs and mental health concerns. So the humanitarian needs are related to the mental health concerns. So for example, of households who had severe needs, 60% reported having mental health concerns. For those who had extreme needs, 70% reported having mental health concerns. And for those who had extreme plus needs, 78% had mental health concerns. So there's a direct relationship between need and having mental health concern. And you can also see that according to the different oblasts. So for example, in Donetsk and Khersonsk, where our assessment sees high levels of extreme need, there is an ubiquitous mental health concern among the households surveyed. So in Donetsk, it's more than 4 out of 5, and in Khersonsk, it's 3 out of 4 households. And while the plurality have mild difficulties completing daily tasks, it is concerning that 41% reported that those household members were having severe or extreme difficulties carrying out daily tasks because of those mental health concerns. And again, when examining groups which have the highest need, you're seeing that they also have the highest mental health concerns. So IDP households, households with a disability, as well as older households, so households which are only constituted of those members who are 60 years or older or more, are all having higher mental health concerns. Now, if you go to households who are receiving MHPSS support, of the 63% who reported having a concern, only 22% have received some type of support and services by the different providers. So the vast majority have not received support. In terms of the form of support they received, it has varied quite substantially. But interestingly, it seems that it is a highly individual decision or circumstance which leads to those receiving mental health support. So we're not seeing differences in terms of location, in terms of demography, and in terms of proximity to the front line and border with the Russian Federation. The one exception is lower income households. So we are seeing that if you are lower income, you are less likely to receive those services. Now, of course, we see humanitarian need as a huge challenge, as are mental health concerns. But now the question is, are those subjectively deemed as a significant challenge? So around 6% of households reported that it was the challenge that was affecting their household the most. So that might seem like not a lot, but actually it's the 4th most cited area that households deemed as the most significant challenge, behind income or money, access to adequate health care, and access to sufficient food. Importantly, those with displacement experience were more likely to report it as a significant challenge. So that includes not only IDP households, but returnee households, and specifically those households that have been displaced within the settlement. In terms of the services needed but not available, again, what's very interesting is there's clearly a need. People are not necessarily getting the support they need all the time, and it is a significant challenge subjectively identified by households. And it's also a service that households themselves are seeing as needed but not available. So For women and girls, it was the most cited or most specified need, actually, among all households, was psychological support. And for children, it was the second most specified. So it was behind recreational activities. So a clear indication that there is awareness that it's needed, and it is actually one of the most preferred forms of support at the moment. So what are the key messages from this assessment that we do every year from the MHPSS perspective? So need and mental health concerns go hand in hand. As needs increase, so do mental health concerns. So it speaks to a need to streamline and mainstream these mental health programs into overall humanitarian need support programs. These concerns are also severe, so 41% are having severe extreme difficulties completing daily tasks. So they're not mild, they're needing of immediate support and programs. Further, the support is not enough at the moment, so of those households that are having mental health concerns, only 22% have reported receiving that support. That could be because they didn't seek it out or because the services were not available. It's not clear, but what is clear is that why a household has accessed mental health support and received it is highly individual, with the only indication coming from income, which seems to negatively impact a household's ability to receive support. And then finally, in terms of the significant challenges, it is identified as a significant challenge among households, and it's also identified as a service that's needed, but which there are gaps. So there's awareness which is increasing, that is increasing perhaps at a higher rate than the services are available. And then finally, and something that is quite important, is that it is common among all groups and all geographies. And that's something that speaks to the widespread nature of the need and the ability that there are many groups in Ukraine that are benefiting and that would benefit from these programs and are needing support. Thank you.
Mackenzie Simon, thank you so much. Дякуємо. Дякуємо.
Thank you very much. The next research regarding MHPSS needs and access to care. I would like to give the floor to Denise Asaf, the information management lead in the WHO in Ukraine.
Добрий день. Good morning, distinguished government representatives, partners and stakeholders. I would like to thank you for the opportunity to present the findings of the Health Needs Assessment Representative Survey for Ukraine, specifically focusing on the 2025 round. This survey focuses on understanding self-reported health needs, particularly access to primary health and specialized care, as well as medicines. It also identifies barriers and tracks changes over time and across macro regions, and we will discuss that as well. On the first part of the presentation, I will look very briefly on the overall health status, because that will also set the pace when we look at the mental health. And we will also later focus on self-reported mental health needs, coping strategies, and access to mental health care. Very briefly on the methodology and the sampling, because this is important when we discuss the results later. This is a nationally representative household survey and is conducted since 2022. 7 rounds have been completed from September 2022 to April 2025. Each round has around 4,000 randomly selected respondents. They're interviewed through computer-assisted telephone interviews, and usually it's about 20 minutes per interview. Importantly, the health needs assessment is not only a mental health survey. It provides also a comprehensive national picture of population health during the war, and also mental health is a crucial part of the broader assessment. A little bit about the geography and the sample, because this is also important when we compare results and we look at the results. The sample includes respondents from all regions of Ukraine. except for temporarily occupied territories. And we focus on macro-regional analysis and also vulnerable groups. These are groups that actually are at the frontline areas as well as internally displaced population. The macro regions are also further divided, especially the frontline areas, into most effective regions and regions of increased vulnerability, and we see 9 oblasts divided there. We also look at Kyiv city alone and the rest of the country when we compare results. The geographic age and gender distribution is consistent with national demographic statistics, and this also helps us to compare to other as well studies. In this study also, in this survey, key vulnerable groups are well represented. So we look at households with children less than 18, 36%, 33% have elderly members. We also look at 34% have chronic diseases and 27% have disabilities. And this could also be additional stresses, also on top of the war. So actually, this is questions that we have added 1 year ago when we were approaching the date of 1,000 days of war. And we see here that 68% of respondents reported that their health has worsened compared to the pre-war period. Yes, this is expected, but it's also as mentioning that this deterioration is more among certain groups. So we see 70% of the internally displaced populations, females reported worse health at 73%, and older people also feel the deterioration more than others. Looking at specific health problems that worsened the most, we see that sleep disorders at 68%, musculoskeletal problems at 66%, and notably mental disorders rank third at 62%. But also we see that most of the deterioration, if we look deeply, it's related to mental health issues, including sleep disorders, insomnia, nightmares, as well as mental disorders such as stress, anxiety, and depression that is reported by the responders. As mentioned earlier, understanding the overall access provides essential context for also examining mental health needs, because mental health is also part of the health services in general. In April 2025, the overall level of access to medical services remained stable. 56% needed some kind of medical services, and if we compare to the onset of the war in 2022, we see improvement, yes, and those who could not get needed health services decreased from 33% to 6%, and this is due to all the support and catering for to keep the health system resilient. However, 64% of those who sought medical care still faced at least one problem while receiving services, and this could be due to no documentation, the cost of the services, transport, and also security issues, as we know. Also, it is most important to look at disparities when we look at regions. In frontline regions, more people face problems when seeking care, although seeking care was less in those regions when compared to other regions. In general, access to family doctors, this is also in general before we dive a little bit deeper into the mental health. Access to family doctors is widely accessible across Ukraine. For the majority, it's through in-person visits or by phone calls or through online channels. And we see the percentages there. And since the start of the war, access has improved. So at the beginning, no access was around 14% in 2022, to currently decreasing to 4%. And this also we could attribute it now to the different modalities that people could access their family doctors, which is through phone calls as well as online channels. Internally displaced people and frontline areas reported less to no access to family doctors. So now, having reviewed or touched base a little bit about the overall health status and access to services, we now turn to the critical issue on mental health. Couple of slides and then I will wrap up. So I think this is where, Jarno, in your speech, you were mentioning. So the survey actually tracks several key indicators on mental health among also other health services, one of which is anyone in your household currently too upset or worried to do their usual daily activities. And this question has been carried with us since every single round. This indicator, we see that it remained stable at 12% to 14% during 2022 and 2023, because people were still trying to either to relocate or to discover what they are going to do with their lives, children, and how things will settle. However, in October 2024, it increased to 18%, and in the most recent round in April 2025, it's decreased slightly to 16%, but importantly, it has not returned to the pre-2024 levels, and this is because the stressor, which is the war, still continues. It's worth mentioning that vulnerable groups show significantly higher rates, so we see that households with people with disabilities are more actually upset or worried to do their usual activities, which is 24%, 20% in households with chronic diseases, followed by 20% in households with low income. The rate increases with age, and we see that 19% is among households with elderly members over 65, as well as if we look at regional disparities, we see that rural areas show slightly higher rates at 17 compared to urban areas. So when we look at host communities, ITPs, frontline regions here, we see that there's no significant differences reported between IDPs and people who remained in their home communities. And this could be actually because when people have both physical and mental health problems, they report mainly on physical issues because it's more visible. First, that's what they report on. Additionally, this is a household survey. So I could be either reporting individually or on somebody in my household member. So, and to tell the truth that mental health issues are not always admitted or shared with household members. So to capture actual differences, we might need a more detailed individual level questions. And this is where we know that no tool and no one survey could actually tackle or address or find all the issues. And in this regard, the health needs assessment is a flexible survey, so we either add or remove questions from round to round, and this is based on the situation and also based on from technical expertise from our technical colleagues from the health cluster partners, WHO, among others. So and in this regards, because we add and remove questions, a new set of questions on mental health and access to healthcare services were added in this round. And according to the results, 72% of the adult population of Ukraine has experienced mental health challenges in the last 12 months. So maybe 12 months is a very, very far period, and maybe people don't recall. So then we looked at actually responders from 2 months. We asked them to respond to recent 2 months period, and we found that half of the responders, 50%, reported experiencing severe stress or other mental health problems in the recent 2 months. So it's still high. And among the issues reported were those related to feeling irritable, constantly worried, overly anxious, or having trouble relaxing, which was 62%, followed by low mood, trouble sleeping, poor appetite, or difficulty concentrating at 60%, and feeling very stressed at 54%. So 20% of those who had mental health issues sought help from at least one type of specialist. So here we're looking at family doctor, 13%, specialist mental health professional, 15%, and non-medical specialists, which is good to know, at 8%. And the non-medical specialists, when asked, these could be social workers, community volunteers, representatives of public organizations, and even religion priests. And encouragingly, I know that sometimes we want to address all the numbers that show that the situation is always deteriorating. It is somehow a very hard situation. However, it's also good to mention some positive numbers here. Encouragingly, over 90% of those who seek support were able to successfully receive assistance. And this is due to all the support, the trainings and other support that is being provided at the primary healthcare center, among others. And as well as they were generally satisfied with the care they were provided. 64% of respondents are aware of self-help techniques to cope with stress, such as breathing, relaxation, control circles, so these that they can do with themselves, but also with their family members, and 79% applied these techniques. I didn't mention it here, but it was higher among females. I think this is the slide before the last. It's also good to look at the medication and the practice behind the medication. So 33% took medication to deal with mental health issues, and we see that 8% took it regularly, but 25% took it from time to time, and when they felt it was needed. Of those, 28% received all their medicines, and 11% received some of the medicines which was prescribed by a doctor. And a substantial proportion of 60% acquired medication without a prescription. And I think here what we need to do is to maybe delve deeper and look into this issue without drawing any conclusion. But this is why we do these studies, so that we can find some issues and then address them and look if they are really significant or not. I think here, this is the last slide, just to talk a little bit about access to medicine in general, but also to focus a little bit on mental health medicines, because that's also important. Despite some challenges remaining, we see significant improvement in access to medicines, although issues still persist. In April 2025, access is stable, and so 8% of the households only couldn't obtain needed medicines in the previous 3 months, and this represents a major improvement if we look at it from 34% in April-May 2022 round to April 2025. Additionally, some households reported challenges in obtaining necessary medicine, and the most common challenge was the increase in medicine prices, reported by 71% of the households. Now, for mental health medicine specifically, 10%, which is 1 out of 10 responders, could not access needed medications. So notably, we can see here also that mental health medications more or less are more accessible than those for other chronic conditions, as well as those for cardiovascular diseases. I will not go through the slide. I think we've addressed all of this. In the interest of time, I will go, this will be with you, and this is available for your reference. All 7 rounds of the health need assessment reports are publicly accessible online in both Ukrainian and English. Please familiarize yourself with it. And for more information or to discuss these findings, please feel free to reach out to WHO and to me, and we're more than happy to discuss and incorporate your additions. Thank you for your attention, and WHO Ukraine remains committed to supporting those who support others. Thank you very much.
Thank you. Дякуємо. Деніс Асаф. Дякую. Дякуємо. І одразу до наступного дослідження.
Thank you. Moving on to the next research. Olga Gorbanyova, the head of the regional coordination, the expert of the Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine, and Olga will share the results of the research of mental health assessment of service users and the capacity of the service providers on the community level. Hello, colleagues, friends. So good to welcome all of you here and those of you who are with us online. Today we will speak about the research which we conduct together with the regional coordinators from the beginning of our work. And actually, it's important to say before we move on to numbers, these numbers will show what Oksana Zbigniewa has mentioned today, but you will see how our system of coordination started from 23 regions, 23 regional coordinators. That was our first research. Then 132 community level consultants joined. They were the consultants of the first wave. And the third stage, the third wave, 168 consultants, 186 consultants. With each level, we had the survey of service providers, and you can see the changes in numbers. This survey has become the foundation for our next work to understand the urgent needs, which are not just documented on paper by some organization. We had a chance to really talk to each service provider and service user to understand where we overlook something important and how we need to move forward. The first research by 23 coordinators covered for 114,000 people. The second wave was conducted by 132 communities, and also there were 140,000 people surveyed, and the research, which we will tell you more about, the second wave of consultants, 86 communities were a part of the survey. So the statistics of the second wave of consultants, almost 25,000 service users and more than 12,000 service providers. You can see the distribution by males and females, and also it's important to say that 57% of respondents covered the age group of 20 to 60. It's important to say who is next to you when you face tough times. So we had a question like that in the survey, and in terms of the regions, these numbers differ. If we take the general statistics in the country, 80%, first of all, they talk to their families when tough times are there. Then we will tell you more. But about the first point, the family, and the second point, friends, 61%. And this indicator correlates depending on the location of the region. The closer the region is to the front line, the higher is the indicator of friends, and the lower is the indicator of family. Here, the peer-to-peer principle works, where it's difficult to cope with the situation. People find it important to communicate with those who stayed in the same conditions or those who left the territory. So what information sources are trusted? If we look at 3 years of this research, we can see that the official governmental pages were the leaders in 2023, but if we look at the dynamics within 3 years, then the percentage of people contacting specialists is getting higher. If we look at the regional distribution by communities, it's an important fact to say that if we speak about Telegram or other social media, like people checked the governmental social media or official social media, that traumatic experience map, we understand why these indicators are like that and why we have this level of traumatic experience. But it's also important to say that everything depends on the proximity to the front line and the triggers. But if you look at this anxiety map in the correlation of the request of service users for support groups or the sector of non-specific services, cultural sector, where people want to communicate more, get psychoeducational services to understand what condition they have and how to work with it. So about 97% are in the regions which are close to the front line, Kharkiv and Sumy. The trend on the service awareness about the services, where the person knows where to go, how to go there, and how to get the service that is needed. At first, in 2023, this indicator was only 18%, and then within 2 years of the work of the regional coordination system, this percentage increased to 47%. Of course, we worked hard to create the guidebooks which help on the community level to refer all the target groups at the level of psychological tension. The reduction from 46 to 25%. But if we dive deep in the research and see what helps people reduce this tension, then again it's important to say about the awareness. So we know where to go, we know self-help techniques, and the psychoeducation level goes up, and thanks to that, the tension level goes down and adaptation increases. Likewise, if we speak about emotions, this slide is so interesting. At first glance, you can say that we became more happy, because the happiness indicator by subjective self-assessment has increased by 1.7 times. But here it's important to look at the adaptation that I've mentioned. When we start getting used to the emotions, which start quietly destroying us from the inside. It's important not just not to feel the fear, but to understand when we can work with that fear, and when we know how to live through this fear and what to do with it next. Because sometimes happiness may be the defense reaction which helps us to cope with the difficult situation. So of course we can see the increase of happiness, but sometimes we block what's inside of us with this emotion, and we cannot foresee the consequences of that. So how people asked for services throughout 3 years. We can see that in 2023 this number was 17%, and in 2025 this indicator increased to 31%. Every third person on the community level today received one service or the other in the area of mental health and psychosocial support. About the readiness to ask for help when the person knows where to go, and when the person understands that if he or she is not okay, then this person is ready to get this service. In 2023, this readiness was 23%, and as of today, 46% are ready to ask for help, and they understand that there is nothing shameful to ask for help. It's about strength. Two realities of the system. So we see the higher indicator, the higher number of those who are ready to ask for help, but on the other hand, the professional load and burnout increases. If we speak about the correlation of the training system and additional trainings for service providers, an interesting fact would be that in the research of 2025, 94% of respondents said that they finished at least one or more trainings in the area of mental health or psychosocial support. But the indicator of those who are ready and who think that ongoing trainings and empowerment will make them stronger as personality, that is also 97%. We can say that the trainings and professional development, in particular requests, which are the most popular, how to work with children with stress, trauma, where specialists feel that they have not enough competencies to work with these challenges. Let's keep going. So what can we say as a conclusion? First of all, we do understand that these days within the mental health program and the deployment of regional coordination, people have become more aware on the community level. They understand what to do. We have psychoeducation thanks to the joint action day and trainings and activities which we have weekly with the coordinators. It makes people more resilient. It helps them to keep going and cope with the situations when they are not okay. On the other hand, the support of specialists and trainings, it correlates with how people need that. So this is one boat where there is the service provider and service user, and it builds trust where people are ready to support and others are ready to ask for help and open up because they understand that they will be listened to. Thank you. Thank you. Thank you, Olha. Okay, ladies and gentlemen, in this section, we will hear two more researches Anastasia Holoten, Ministers of Ukraine, and the topic is the preparation of non-medical workers in the area of mental health, the challenges of the time, expectations of people, and the market needs. Hello, dear participants of the forum, those who are here with us online and offline. We will really speak about non-medical workers because the services provided by these specialists are about the accessibility of support in the area where a person lives. In this research, you will not see a perfect picture, but this research will show you the reality and how those who train and get trained feel what are the gaps in the curricula and professional education and what the labor market needs. When we speak about the preparation of the specialists, it's important to speak about the trainers and the burnout of trainers and lecturers. This is not a sporadic case. This is the systemic sign of overload. 45% of surveyed educators have average burnout level and 13% high level. More than a third of respondents are motivated and feel satisfied in their work, and they feel that their work has the meaning. At the same time, also 1/3 already feels burnout and is on the edge of burnout. About 30% lose contact with their social circle, or to some extent they shift away from doing their work tasks, and it means that the burnout is getting closer to this group of people as well. Then again, when we speak about specialist training, we focus not just on those who are the trainers, but also on trainees. If we speak about the emotional condition of the students, trainees, we can see that most trainees, they feel anxiety and elevated tension, and 12% of them feel severe anxiety and psycho-emotional tension. At the same time, among the students, among the trainees, there is a good trend. In general, the students feel high control over the events which impact their lives, and they feel as active creators. More than 1/3 of surveyed students say that, and 17% also say that they have high level of hopelessness and they don't feel any impact. They see no hope for the future, and they cannot feel that they are the subjects of their lives. It's very difficult to build the conditions for education in this way, and if the educator feels burnout, it's very difficult to share the values and standards needed for the specialists of mental health. If we speak about the burned out students, it's very difficult to take for them the professional standards, ethical norms, and develop the empathy and sensitivity, which is important for mental health specialists. Together with anxiety of students, we can also see the positive trend that most of them, they have high level of internal emotional resources, and in general they show the positive emotional mood. 25% of students at the same time feel exhaustion, anxiety, depression, and 27% are in the potential risk zone. This potential risk zone is the most sensitive. It means that the university has to become not just a place where the knowledge is shared, but it has to be the place of psychosocial support where both educators and students may get the mental health service. Despite all the challenges, we can see that the psychology and such specialty as psychologist is in higher and higher demand each year. Back in 2020, this indicator was 2.8%. In 2024, we can see the indicator of 5.6% of all the students, of all the applicants they want to become psychologists, and it means that there is higher interest to mental health in the society, because those who finished schools yesterday, they choose more and more the professions in mental health area. We can also see the positive trend of interest to psychology, and that's why we need to understand who is the mental health specialist. It's not just a psychologist, because in this area of responsibility there are a lot of other specialists like psychotherapists, psychologists of different areas and professional fields. I mean social workers, psychosocial rehabilitation workers, clinical chaplains, and so on. It's important to say that these days in the Ukrainian higher educational institutions, all these specialists are trained, but the research shows that we have a huge problem related to the compliance of the educational standards with the professional standards and availability of the professional standards. We need to solve this issue, and for that the professionals need to cooperate. If we speak about higher educational institutions training psychologists, we can see the following situation. All the regions of Ukraine have such educational institutions. Apart from that, psychologists can be trained even in the higher educational institutions which are purely technical. And of course, the biggest number of them is in the big cities, Kyiv, Kharkiv, and Dnipro. The similar situation is in the area of social workers. 21 higher educational institution prepares social workers in Kyiv, and the regional distribution shows us that most of these institutions are in the big cities. It's important to speak not only about what number of higher educational institutions trains students, but what is in the curricula. The assessment of the curricula shows that most curricula formally comply with the state standards, national standards, but at the same time, when we speak about the strategic integration and correlation with politicians, correlation with the policies and regulations and latest updates, we can see that 53% of all the curricula are clearly connected with the latest changes in the legislation, and 39% of all the curricula have modern methodologies in them. Interdisciplinary approach and the connection between the specialties is a significant gap, even when we speak about the higher educational institutions, which at the same time prepare the social workers, social educators, and psychologists and other mental health specialists, and which have such capacity for this inter-agency integration. The next indicator which was assessed is the staff potential. Here we have the high level of the assessment of the educators, but if we dive deeper and speak about the systemic professional development of the educators, engaging the practitioners, then we can see the gap. And we feel this gap in the practice area of the education and the possibility to introduce supervisions and training approaches into education and other practice-based approaches, because a lot of the educators who have only theoretical educating activities and are not practitioners, they don't have the knowledge about the practical approaches on high enough level. Apart from staff, it's also important to speak about the material provision and the assessment of the education and training results. Here we also can see a significant gap. It's impossible to assess the access to the modern psychodiagnostic methodologies, and it's impossible to assess the independent assessment of the curricula, because the research shows us that Ukraine has a huge gap related to the access to psychodiagnostics methodologies in the preparation of specialists. I mean, we have outdated methodologies, those which are not relevant anymore old post-Soviet methodologies, or these are very expensive international methodologies which higher educational institutions simply cannot afford. And the final block, the final assessment criteria, is the assessment of ethical standards and the innovation block. Here, the compliance with the ethical standards is also the weak area which needs to be improved, and it's not in the curricula, and only 26% of the curricula include innovative technologies. You can consecutively track that. And about 30 curricula have real scientific work as a component. It means that it goes beyond this higher educational institution and really impacts the services and the service market. Now let's move on to the assessment of the preparation of the specialists. In this case, it's important to listen to what employers say. And when we listen to the employers, we will see the same trends. 7 out of 10 employers say about a huge gap between what the young specialists are trained to do at the universities and what the employer actually needs from the employee performing professional tasks. Apart from that, the employers say that the specialist with the same degree, with the same specialty, very often depending on the university he or she graduated from, these specialists, they have different skills. For example, social workers may be focused on projects and project activity or psychological components, but at the same time, both specialists will be named social workers. Now, if we speak about the alumni and how they see the prospects of their employment, the situation is quite positive in the area of psychologists. More than 60% of psychologists, they plan to continue their profession and they see professional prospects. But most young specialists, they want to work in the private practice and they consider state sector, governmental sector only to start their professional activities. When we speak about the alumni social workers, only 25% of them say that they are ready to continue their professional pathway. Most of them do not consider the governmental sector as an option, and most of them, when they graduate, they want to work for NGOs, which offer higher salaries. And the specialists working with youth. Only 20% of alumni with this specialty are willing to continue working following their specialty after they graduate, and most of them, they want to only start working in this area as the first employment place, but then they move on to other sectors. So where are we going next, and what do we need to align the educational system with the professional system so that we would actually have capable workers? The research shows that the higher educational institution is not just about knowledge, it's about services as well. The students, educators, community residents, they have to have the opportunity to get mental health and psychosocial support services in the higher educational institutions. Apart from that, the implementation of such a model opens prospects for the practice of students and to implement that practice-based training. Next, practice-based training, engaging the practitioners into educating for students, and right now this is the so-called must-have, and the higher educational institutions really need that. And the third final point is synchronizing professional standards with the educational standards, because this is something that most employers mentioned. The real challenges of practice and practical skills are absolutely different from those that students get at the universities. The research showed that mental health sector changes and specialist education in the area of mental health has to change accordingly, not just on the paper, but in real life and in real experience of those who educate, those who study, and those who will continue working as mental health professionals. Actually, we have positive practices. We have a lot of work ahead of us. And one thing is for sure, everyone who is here today, you have all the resources and capacities to join the changes. Thanks to each and every one of you. Thank you, Anastasia. Meanwhile, ladies and gentlemen, we're getting closer to the final research result, and this is the Global Prospect Overview. Fami Hanna, the representative of the Geneva WHO office, who will share the global progress via the Atlas of the Mental Health of the WHO 2024.
Good afternoon, everyone. I'm delighted, honored, and inspired to be with you in the third Ukrainian Mental Health Forum. Please do invite me in all next Ukrainian Mental Health Forums. This is a presentation inspired by How Are You? This is a presentation about how globally we are doing when it comes to mental health programs. With a bit of zoom in on Ukraine compared to the rest of the world. How are we doing? You will notice that the Ukrainian numbers, the Ukrainian statistics are telling us a story of commitment, a story of hope. The symbol we are putting here in the cover slides is a symbol about rebuilding. Let's go deep dive. What is the story behind the numbers? How can we measure how are we doing when it comes to global mental health? The member states, countries, has agreed on the Mental Health Action Plan, which was endorsed at the World Health Assembly. The Mental Health Action Plan 2013 until 2030 has set clear targets. WHO monitors those targets by member states of the whole world, of the 194 countries that represent the World Health Organization, submit their data to WHO. This process has been ongoing actually even before the endorsement of the Mental Health Action Plan. The first atlas is in 2001. So you can really measure across the years how countries are progressing when it comes to their mental health programs. The most recent atlas was released actually around 2 months ago. So this data is very fresh. This data represents 2023 work that was submitted to WHO and published into 2024. The whole report was published 2 months ago. The news are not great. The world is not reaching the target that the member states has committed to reach by 2030. None of the targets now is reached, although the Mental Health Action Plan has started in 2013. The progress in some targets are really not promising, and they are the targets we need the most. For example, primary health care, nearly 30% of countries reaching the target we wish to have by 80% of member states having a fully functional mental health integrated into primary health care. A functioning information system when it comes to mental health, again, around 30% of countries only have. Imagine having a functioning minimum set of indicators for mental health. 30% of countries are able to report on that. But there is some progress in other indicators, such as prevention and promotion. However, none and mental health action plans and mental health policies. Actually, some of the indicators between this round and the previous round has regressed, such as country fulfillment of developing laws related to laws that acknowledge human rights in mental health. This is not a story about failures. when we did not reach the targets, because this is also a time-mandated to-do list that the countries have set themselves for a commitment until 2030. If you look at this statistic, it tells you why we are in this position. So we are in this situation because the financial contribution by governments to mental health services has not changed since 2017. We're still at 22% of member state budget for health dedicated to mental health, which is very low, noting that this condition burden when it comes to disease exceed 13%. However, government of the world has not increased the budget. The same when it comes also to the median related to the workforce, which is the topic of this year forum. Also very small. Half of the countries of the world live in a place where there is one specialized mental health professional for every million population. Actually, this is the indicator I just mentioned. There is a regression. But there is a paradox here. The regression is in countries' perception of the alignments of their laws with human rights. There are less laws being developed, and actually among countries that do have laws, they start to rate themselves less. So one can argue that this is a good practice because that's a self-checklist. Countries may be comparing their self-alignment with a human rights checklist and decided to score them lower. It means that they need to do more when it comes to alignment with human rights. While the doors are there, the passes to these doors are not there. Only 10% of countries said that they have completed the path of reforming their services to become community-based mental health services. Less than 10%, actually. Half of the countries just started towards community-based mental health services. A bit of discussion around emergencies. The only indicator we have within the Mental Health Action Plan, which is about emergencies, is the target to have 80% of countries integrating mental health and psychosocial support in their emergency preparedness plan. In fact, this is the only target that showed in this round 20% progress. Thanks to initiatives such as the WHO Build Better Before workshops and exercises that Ukraine was one of the pioneering countries that implemented, but the concept of integration of preparedness also came during COVID-19 when countries recognized that all need to start investing more in preparedness, and that applies to mental health as well. When it comes to emergencies, Atlas is telling us countries consider that 85% of countries that have emergencies are integrating MHPSS. But Ukraine, one of these 85% that decided to take a very different and unique route. Ukraine actually proposed to the rest of the world to endorse an action plan, to endorse a resolution on integration of mental health and psychosocial support, not only during, but before and after emergencies. A very different path, a source of inspiration for many countries, and what's really more inspiring is that all countries of the world has endorsed this proposal based on a proposal from the Netherlands and Ukraine, a country passing through a very difficult, challenging time during a war situation. Again, 71% of emergencies, I would now say only 71% of emergencies, have a functioning coordination system. We heard this morning from previous presenter about the uniqueness of Ukraine coordination. Ukraine not only having the largest number of mental health and psychosocial support partners, but is having unique and pioneering coordination localized system through the coordination center, through the technical working group, through the local coordinator, and through the oblast level coordination groups that was formed. Let me take you through the systems component, how Ukraine Mental Health Atlas country profile looks like. When we look at the workforce, Ukraine's statistics stand in the middle between Europe and the rest of the world. Based on the data submitted by the ministry to the Mental Health Atlas this round, 33.9%, almost 34 per 100,000. The rest of the world is at 8.6. However, that's a bit below the European standard of 53. These are not numbers, colleagues. These are case loads. These are gaps in service need. That innovative mechanisms, such as those being applied in Ukraine as task sharing through image gap and building the capacity of workers, is trying to bridge this gap. And still it would need long time to bridge this gap. So as you see, Ukraine is multiple times higher than the rest of the world when it comes to workforce, but still below the level reported by other European countries. This is a summary for most of the targets of the Mental Health Action Plan and whether or not this has been fulfilled in Ukraine. First one, target 1.1, is about having a policy or plan in line with human rights instrument. Ukraine not only fulfilled that, but even during the war has developed the operational roadmap, the all Ukrainian mental health program service model, and endorsed and updated a policy and plan for the country. So 1.1 fulfilled. 1.2, while most of the world is regressing in developing new mental health laws, unfortunately, and failing on this target, Ukraine during the war last year, and in the previous forums there was a consultation, this law was endorsed last year and is in line with human rights instrument. 2.3, integration into primary health care. Again, I think an area where all of us would agree is advancing very well in Ukraine, including I have attended this year a pre-service training or a pre-service workshop for academia to include image gap for integration of mental health into family physicians and primary health care in pre-service training. 3.1, having more than 2 prevention and promotion program. How are you campaign as a stigma reduction campaign and as a community awareness campaign itself, one of the 2 programs, but I'm not exaggerating if I say there are hundreds of programs. We can say that even there are in some oblasts hundreds of programs for prevention and promotion, and WHO actually criteria is very strict to endorse which program, but I think Ukraine has fulfilled the criteria for all of them. Preparedness, the good preparedness work in Ukraine is, I think we see the fruit of that every day in the response. I've seen it in concrete examples, such as after the Kakhovka Dam incident, when there was a rapid response to the mental health aspects immediately starting to deploy in the exact day. So I think we see lots of resilience and investment in preparedness in the country in various regions. And finally, when it comes to mental health indicators, again, this is one which is in progress, but the fulfillment of Atlas data in itself is a showcase for information system and the many researchers before me and colleagues who presented high quality assessments and reports. There is good progress in target 2.2, which is about community-based care. The aim is to have double the number of community mental health centers in the country compared to the baseline. Ukraine is very close, if you look at the numbers here on these slides, very close to achieve this, while actually the baseline, we're trying to measure a baseline of 2022 compared to 2023, which these data reflect. In 1 year, noting this data measurement, with the rise of community mental health center, community mental health team, resilience center, and various community-based services that many of you are involved in, I think there is a great progress on that target. The other target, which still there is a long way ahead, is service coverage, universal coverage for mental health and psychosocial support service. Because we are not measuring it yet. We need to develop a method to measure coverage. However, if we are able to measure it, one would assume that with those many programs, high quality programs across the country, there will be increase in the service coverage. However, to reach the demand of the Mental Health Action Plan, the 50% increase in service coverage, we need to continue doing what we're doing for many years and even do more. So I think this is a clear statement when you compare the various targets of the Mental Health Action Plan towards Ukraine program. In summary, and to wrap up, in a diplomatic way, the world is doing okay. In a clear statement from Ukrainian data and statistics, I think Ukraine is doing great when it comes to progress of implementation of the Global Mental Health Action Plan. please continue what you're doing, because the job is not done yet. To reach the ultimate aim of all what we do, we need to reach universal coverage for mental health and psychosocial support in every sector, for every Ukrainian, everywhere. To be able to reach that, this program needs to continue for many years and even need to do more. But also the world needs Ukraine to continue doing that. The world needed Ukraine to propose a mental health and psychosocial support resolution. The world needs Ukraine to be a role model where indicators are regressing but Ukraine is progressing. Thank you. It's an honor to be with you.
Дякую.
Oh, thank you so much, Fami. Ladies and gentlemen, we have finished with the result of research, but in this section, in this block, we still have a panel discussion that is called From Difference to Joint Vision and Human Needs, Intersectoral Cooperation in Mental Health. So from the overview, we are going to a direct speech to direct voice of services provider, and those are going to be voices from completely different regions and sectors: education, social area work, working with veterans, working in health system, that will be merging into the coordination system of the All Ukrainian program, TEAC, or How Are You? So, and how from different sectors and providers the system is being built, and the center of which is the human being. What kind of challenges exist? What is going good? Where do you need to work more? What are the needs to those who have the mission to help others? About all of that in the nearest half an hour, we'll be speaking with the audience, because we are starting off this panel discussion from difference in job to joint vision on the needs of the person. Not to waste any time, I'm going to be welcoming participants of this discussion. Under your applause, we are welcoming Evgenia Filenko, psychologist of professional development and pedagogic of the school psychologist. She's getting ready, but please take your seat. Irina Zadorozhnya, a regional coordinator of Ukrainian program of mental health, TEAC, in Kherson region of Ukraine. Irina Vira, social manager of the Resilience Center and a consultant Білозірська community of Черкаси Oblast. Tatiana Lukashchuk, a psychologist at Veteran Hub of Chernivtsi City. Oksana Zhan, director of Bucha Center of Primary Medical Care in Kiev region. Who is and moderating this panel discussion is all known Olga Gurbanyova, the head of the regional coordination and expert of a coordination center on mental health of Cabinet Ministers of Ukraine. So please, your 30 minutes are starting now. Greetings to everybody. Thank you so much to dear participants of our panel for being here with us. We are welcoming everybody who has joined us online. And before we will start, we do have a invaluable objective. We do have to cover the basic needs of people. But to do it, there is a bit of time left. Therefore, we need to, as soon as possible, to care for everybody here. Therefore, I will ask you to be brief. And the main objective that we have together to do, so that everything that we will speaking of today in numbers and in the speech of the differences, to open up, how does this happen in practice? So what is happening? How does this intersectoral cooperation is happening? How does coordination is happening? How is it breathing? How is it being motivated? How the main experts are holding up? And today we have different sectors represented. And so here there's a portion, the field portion, and this is happening on the ground in the regions. And so the first, I would just like to ask to the microphone Evgenia Filonenko. Evgenia, thank you so much for being here with us. A school psychologist to care for from the smallest to the oldest. The first question to you, how did your work change as a school psychologist in the time of the full-scale invasion? In the last years, how does this intersectoral cooperation happen? And if there is a specific task where the school psychologist work ends and where the different experts work start that you're cooperating with and where you're referring to, how does this ecosystem lives and goes on. Greetings. So what I'd just like to say is that from the moment of the full-scale invasion, we have increased in number of encounters for mental health support. And about stress specifically, that you can feel right now in a strong way, and mostly adults. And they are influencing the children, the students. And what I'd just like to mention as well is we have an increase in level of trust to psychologists and an understanding that we are competent in helping and supporting mental health. And if we are to mention about the requests and how are they different, any different from what was there before, among the students, we can say that this is an increase in levels of anxiety compared to how it was before the full-scale invasion, and also an increase in encounters of from students, which is panic attacks and the Tourette syndrome and other things, which wasn't there before. And also, just like to mention that after COVID and the beginning of the full-scale invasion, because a lot of times students have been on the remote learning, and in our community only this year they went from the hybrid to a full offline training. Then there's an increase in number of the how to work with the groups of students, because the interaction is suffering a bit. And also in cases when this is outside of the competency of the school psychologists, like panic attacks or language impairment, we are referring to doctors. And I would just like to note here that if before parents were really frightened and scared that we could refer a child to a doctor, then right now, maybe because they're listening more to psychologists, because of the support that they're providing, so they don't have this going against. And then from doctor, they're getting back to us, because what is considered the medical care, they're referring back to psychologist work. So here, this is an interaction, both the family and the students themselves and specialists in your line of work. They're building like a safe area for the family to support and to cover the need that, as far as I understand, is in the student itself. Thank you so much. And so I would propose for us to move on, and the next floor would be given to Irina Vira, to a social manager or case manager of the resilience centers in the social area work. It feels like we thought of this as just social, only social, and maybe somewhere we understood, but partially about the component of mental health. But we do understand that the social area work covers our basic needs first, with which probably people are reaching out to you. So how does the interaction happen, and to what extent there is specific line between specialists of the resilience centers, social area work, psychologists, or this is more so, and the center becoming the place of its own need, because the system is being built around the person, and this is confirmed in work and not just with words. And we are seeing that the person is not lost in the system. Therefore, we are entering the work. We can't say that this is not our competency. We have to support the person here and now, and to provide some care that they need. And here is a big and key role of the cooperation itself with the institutions and the community, and by having the roadmap in the community, and then the referral system is working, that we can see that the person is not lost in between the services. They're receiving comprehensive service and quality service, so that I can make an example. There are situations, depending on what kind of client you're having, when they're being lost, then what we can is directly, because the community is not big, we are all in contact. We all have phones, we are in contact, therefore we can directly call to a specialist to whom we need to refer to. And if the person is just lost in this information, we are referring to, but we are calling and then we are saying that this is the request, and the person can get to you. Maybe not today, maybe not tomorrow, but the next organization will know that the person will come. And just as you mentioned before, social area work covered only social area, like any kind of certificates or some other types of support. And the social workers right now is seeing a person. It was their issues, problems, and here and now they need this kind of support. And I can reassure you that social work right now and mental health is the portion of the same component that are happening as the wellness of a human being. And if they feel this support, this is the level of trust, and then we're seeing our line of work when the person is grateful and thinking that. Therefore, the social area of work is just one component from the ecosystem in the family. Vera, I have a short question to you. An interesting fact that you're creating this ecosystem to the support of but does this happen, the existence of the system, to an expert? So maybe this influence into your state of health or your professional skills. How does this happen from another side? The experts, they're helping with self-development and self-education. It's a big resource of how are you, where there's existing practices that we are using constantly. We are developing their own vision of modern problems, and so that the human can have a quality of health. And our center has become this platform of support, not just to in person, but also to an expert. And the other specialists that can come and then can work if our employees are not fulfilling or can't function. We are open, and everybody know that you can go into the center and you can receive qualified support to a services provider in the community. So you have become a platform for the services providers that are coming to your training, into your facilities, that are to specific things that are referring to the services providers. Thank you for the answer. This is an important aspect because right now our forum is also about supporting those who support others. And here I'd just like to go to Oksana and then the continuation of care provision of two services providers. Today, your center of primary care, it really fascinates us. Every single time when we've been there on the visits, when we visited, it looks like every corner is dedicated to a services provider or to services receiver. And then how can you merge this system into a unified tool or body or organism? How does it work and breathe? Can you tell us more in detail about all of those interesting aspects? And also to how are you holding on? Greetings, dear friends, and I would just like to say thank you for such a great format of discussion, because if you're speaking about the level of community, this is eternally important. And when we are building a patient, then we know what kind of services we are providing, and very actively when they're proactive and independently if this is a social work or this is social area work or another area work. When we are gathering together, when because services are being divided, provided, increased, and so we know how to help this another person. This is about accessibility. Regarding our facility, then for me, as for the leadership of the facility, for me it's important. You know, the war, it's the period not when nothing is decided. This is a small place of safety. Therefore, I'm building the processes in a way that if the patient is coming into a facility and he feels like the support is there, by going in the pathway, they do understand that people know how to help, people are ready to help, and people are helping because all of the medics went for training. And then all of us, as the colleagues has mentioned from the education department, we know how to help. And this is about our direct experience. For me, as for the leadership of a facility, it's important that this employee would be in the resource. And this is a tremendous story that I've given so much time and energy to, because this is again about safety. By coming to work, they feel like they're being taken care of. They feel like there's support to them as by the leadership and the experts. And we are getting together and staying in the resource to help people. Therefore, on the level of community, by doing these services and to employees, and then they're referring to as the expert and the family. Then is then the side of the facility, we're building in between the patient a clear and understandable relationship. As inside of the collective, there is a trust that exists, and this is all about safety. For me, it's important to small but have this ground of safety, like forecasted story, and then so that people would feel more sure, because we are living in such a complex times of war. Thank you so much, and we can move on, and then we'll get back to you though. On the next question to Tatiana Lukashchuk. So you're working as a psychologist in the Veteran Hub. This is a complex line of work. We had said this many times that it's need to be understood that we are not just speaking about veterans, about the family of veterans. And can you tell us, like, how people are getting to you, how veterans are getting to you, how families are getting to you, and then what are the tools for referral in your area of work are actually functioning? Thank you so much for the question, Olga. I am so happy to be present here on this event, on the third Mental Health Forum. And I would just like to highlight that one of the categories of people that are reaching out to us and to the Veteran Hub in Bukovina, this is our protectors, our servicemen, and they're also family members and members of their family. And then we are trying to highlight that in the mean of attention is the person. And the person is being treated by another person. So this is true. Nobody has changed this truth that the person is another person, and we need for this person to be professional, qualified. And I'm grateful to the How Are You program that is preparing, helping, giving us opportunity to experts to be sure of their professionality, of their skill, and to support those who need mental health support. Because before war, nobody prepared us to war. And mental health, I am 20 years here, and psychology of war was not taught to us at the time. So that from 2014 we started to go there and started to improve our skills with psychoeducation. And then because of our aligned work and coordination in our region, and aligned work and the cooperation with the state authorities, with the local authorities, and also, we are trying to sign memorandum of understanding with the charitable organization, NGOs, other sectors, and we are actively cooperating with health facilities, with the state and private, so that we can refer people to and to cover the needs of those protectors, servicemen, that they're reaching out to us. And how are we finding them, you may ask? So our director of the Veteran Hub from Bukovina, he's an ex-serviceman. He's an ambassador of NGO's Steel, and he is a direct participant of military action, and he is an example when we are working in a peer-to-peer fashion, when a person can come with trust to that person that will understand you clearly. So this is a lot of his initiative, of his servicemen, co-servicemen, and as a psychologist, they're working with the men and with servicemen, and sometimes even the couples are coming, like a married couple. And so we were made, we are so happy that we are trying to broaden our audience, so not just men, but also women and also family couples. We know that we are working comprehensively.
I will also add that your chief participated in the peer-to-peer training that we've already mentioned today, and he acts as a person who, gains some skills and knowledge and puts them into practice. Referral mechanisms. What kind of tools do you have as of now? What kind of confidence it brings you? That the person will not get lost in all the services existing now. Of course, we have the referral pathways and also people assistance. When a person ends up in the Veterans Hub for the first time, they have the warm touch, the first line workers with whom they can communicate in a warm way, and no one drags out some words out of them. So if a person grows trustful, we introduce them to our specialists. There are male and female specialists. Sometimes, a person might find to work easier to work with man with man, women with women, but it's not a standard. It has been evolving over time, and people choose those specialists with whom they establish a kind of bond. And our clients are supported by our specialists until their needs are catered to. They are related to legal, social, and other questions. And then, depending on this, we refer our clients either to our in-house specialists or to other facilities. And in such cases, our specialists support the person, they accompany them. So you refer the clients to other specialists, and you do not just leave them on their own, of course. And we provide another opportunity to socialize, to adapt to civilian life through the events and activities that we arrange for. For example, there are such interesting things as, for example, the project which is called iVeteran. This is something new. You will be able to familiarize yourselves with this project. We also work with children. Thank you, Tatiana. I apologize. Oksana always jokes that in the first row there must be a person with a table. We are ready to listen to you for ages, but our lunch time has approached. So now I have a question for Irina, the regional coordinator. I would like to ask you a question about the roadmap. Back then it was very much unclear to us what the roadmap was, and from the moment when you started and then when you were holding it in your hands, can you tell us how beneficial it has been? Thank you. When we started developing the roadmap of service providers in the Kherson region, we noticed that people do not really know where they can seek support from, and the specialists do not see the full picture of the services available. So we set ourselves a task to develop a roadmap for service providers and service users. As of now, this roadmap includes information about where to reach out to, what kind of services people are able to receive. And before the development of the roadmap, our consultants in the community-based level conducted the survey in order to better understand people's needs. They also researched what target audiences we would have. We also did the mapping, collected the data in the fields, and the audit was about checking whether the service was available, whether specialists were available, and such roadmaps and the results of our work were represented at the Spilna Dia Days, which brought together different service providers and service users. The range of services was so broad that we did not even anticipate it to be so, and we were really surprised to learn that some communities had different kinds of services. So that event was very useful for the communities because they managed to engage in networking activities and get to know each other better, I would like to say that the all Ukrainian services are all represented at the platform How Are You, and everyone can access this website. You do not even realize to what extent these services have transformed in different services. You would never think that, for example, within the culture, that libraries, theaters would provide support and care, those spaces which hold different events and activities and provide psychosocial support. I have one overall question for everyone. So, three things, three words about what helps you hold up. Hope, resilience, which we did not even know about before. This is my family, first and foremost, my loved ones, and also the feeling of being useful and beneficial to others. And the third point is faith and hope for the better future. I will be very brief. First and foremost, it's Ukraine, our people, and the family. Personally, what matters to me is my family, traveling, which help us to get hope for the better. Thank you. Thank you very much, Olha. And you saved up another 5 minutes for lunch. Thank you. Dear ladies and gentlemen, we have approached one important part of our forum, which is the lunchtime. So now it's 13:30. So please be back to this room at 13:25. I hope that you enjoy your lunch, get more resourceful, and I
Okay, ladies and gentlemen, I tried to start as late as we could, but anyway, I think it doesn't matter how much time you give for a lunch break, people will still need 5 minutes more to talk to each other, to take a picture. It's so nice that you continue doing that. We hope that you will do that throughout the day. So, what will we do in this block? We will have two big panel discussions, and after them, you'll have a coffee break and you can continue doing what it is that you're doing right now instead of taking your seats. So please take your seats. Let's applaud everyone so that everyone who is not seated would understand that we're about to start. Thank you. You helped me a lot. Before lunchtime, we heard a lot about the experience, opinions, and ideas of service providers in different sectors and how the work of the different sectors is coordinated on the governmental level. What is the vision of the executive bodies of the government about building mental health system in Ukraine and the needs of mental health workers? And I cannot hear a word he's saying. Well, now the microphone works again. So everyone started thinking it's about to start. So everything I managed to say in the mic while it was working, that's what we'll discuss next session. So panel discussion. Professional in the center of building mental health network, different sectors cooperating in building mental health services. So let's invite the speakers. Katarina Pavlichenko, Deputy Minister of the Ministry of Internal Affairs of Ukraine. Yulia Kirillova, Deputy Minister of Veterans of Ukraine. Mykola Trofimenko, Deputy Minister of Education and Science of Ukraine. He's skipping the discussion. Inna Solotka, Deputy Minister of Social Policy, Family and Unity of Ukraine. Ulyana Tokareva, Deputy Minister of Youth and Sports of Ukraine. All the participants are here, so now we have to invite the moderator of the discussion, Anastasia Holotenko, the experts of the Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine. So everyone is here, and the time count starts. Hello, Timur. Hello, participants online and offline. Today, many times, we heard the statement that today's forum and the topic of mental health support is all about supporting not just those who are service users, but also those who are service providers. I mean psychologists, social workers, doctors, and other specialists of assistant professions. Today's panel will be about making sure that supporting specialists is not some optional assistive function, but anti-burnout practices have to be cross-cutting. So, Katarina, right now I'd like to address you. I know that the Ministry of Internal Affairs has great experience, and your specialists, the specialists of your sector, they end up being first in the emergencies and in the places where we see the consequences of different rocket attacks, missile attacks, and they need to help people all the time in these emergencies. So I know that you have the presentation video about it. Maybe let's start from that. Hello. First of all, I want to thank you for the invitation and the possibility to speak in this forum. Actually, I would like to offer right away to watch the video that we prepared dedicated to the Psychologists Day, and it's quite dynamic, showing how our workers work in the locations of emergencies, and I'll add more information to that. Psychologists of the State Emergency Service, the National Police, they are the first responders in the most difficult times. They help cope with fear, pain, and uncertainty. It helps save thousands of lives. From the beginning of the year, we made 282 visits to the places of attacks, and more than 10,500 people received support. 284 psychologists worked in the places of attacks. In the evacuations, psychologists supported 10,673 persons. So they conducted 4,794 psychological support and awareness-raising activities. Psychologists in the system of the Ministry of Internal Affairs are there for you. You're not all alone. Let's applaud. Thank you so much. To continue this video, I'd like to say that the topic of the forum today is really important, because our task is to think how we have to support those supporting people in the most difficult situations. The departments of the system of Ministry of Internal Affairs, these are all about people, hundreds of thousands of people who are there for people in emergencies, in the areas where the fire is put down, in the situations where the civilians are evacuated from the pre-frontline territories. It's always the situation where people actually need support. And due to that, we say that our departments of the Ministry of Internal Affairs, I mean the National Police and the State Emergency Service, they are the first responders. When we get the call to 102 or 112, when specific units go and fulfill their function, provide support, and in this moment the workers of psychological service of the Ministry of Internal Affairs are always there to support people. So everything depends also on the good mental health of our workers. It impacts how they will provide care to civilians. Realizing that the topic of mental health is one of the key topics in the list of tasks of the Ministry of Internal Affairs, and building policies and practices in this field. That's why you could see the main numbers on the screen. I will not repeat them, but I'd like to say that in contrast to 2024, the engagement of the Ministry of Internal Affairs has increased by 2 times, and the engagement of psychologists to the emergencies has increased. Of course, it's due to the increase of the number of attacks on civilian objects, especially the number of these attacks is higher in spring when the enemy attacks our infrastructure, hitting the multi-story buildings, and the workers of psychological service always go there. Also, I'd like to highlight that for us, it is really important to have 2 main directions in the areas of support of our specialists. First of all, that's professional training to increase the level of the workers' competencies, and secondly, psychological relaxation to help preserve internal resilience after difficult visits and tragedies. For that, we implement the standardized protocols of work for the departments of the Ministry of Internal Affairs for the psychological service so that this aid would be systemic, effective. It is so important to ensure the control of the work of the departments. And to do that, we implement specific digital subsystems like social legal protection, where psychologists and social workers can track all the support provided to the workers of the system of the Ministry of Internal Affairs. You know, the psychologists of the Ministry of Internal Affairs, they focus on 3 directions. The first one, work with civilians. The second one, work with our workers of the system of the Ministry of Internal Affairs. And the third one is the work with the families of the workers of the Ministry of Internal Affairs. We have this sensitive group as the family members of the workers who died or who are missing. We understand that in each of these directions, people face emotional load. It's important to support our workers. That's why we create additional trainings and opportunities to get trained. And we use the platforms and opportunities provided by our partners. I mean the Coordination Center for Mental Health. To sum up, I'd like to say one important point, in my opinion. In our system of the Ministry of Internal Affairs, we're trying to build this cooperation of different services and departments, not only, as you've said, of psychological service, but also social service departments, to have this comprehensive approach. It's important to have the interagency comprehensive approach and on the level of territorial communities. Let me give you an example. When the consequences of emergencies are eliminated, in the future we provide only emergency care. In the future it's important for the community and social services to support the person who received the care and support. And I hope you'll all agree that the mental health of the person depends on a lot of different factors, including the support which was received on the recovery of the accommodation, and if we're speaking about the destroyed accommodation, on the use of psychological services, all of that impacts mental health. So that's why we need to have coordinated, united actions, and then we'll have comprehensive care and support. Thank you, Katarina. Thank you that you shared the experience of your sector. Let's applaud to you. And I want to thank you that you mentioned intersectoral approach and that you highlighted that the most important thing is not just the crisis response. It's also important to consider what is happening with the person in the future, in the community, what services the person may get in the community. So it makes sense to ask the next question to Inna, because the military context requires flexibility and brave decisions from the system. One of these decisions was to rethink the system of social support, the social area, because the development of the network of resilience centers, this is in a good way the true rebranding of social services and the transition from the fact that the social services are provided only to those who are in the most difficult situations to the situation where every person can come into the resilience center and find the necessary support. Inna, please tell us, how do you manage to implement this network? And tell us, where do you see the element of training of specialists? You know, new services require new skills and the development of these skills among workers. So what do you do about it? Thank you. As of today, I can tell you for sure that the resilience centers, personally for me, in the resilience centers, people get the best quality service. And visiting different regions on business trips, when I personally go into the resilience center, I become an ordinary person, not an official who is there to audit something. because resilience centers have fantastic environment and you right away dive into it. So for me, it is like magic. It is the way it has to work and how the system of social services is changed, how we take steps forward regardless of what's happening today and how difficult it is for each and every one of us. That's why the question is that we have more than 300 resilience centers, and next year we will have even more resilience centers in Ukraine. And we have more than 1,500 workers in them. But when we implemented that as an experimental project, right now we've given the government the draft order to continue this project for 6 more months, and then these centers will become constant because we truly see the needs. But if we say that there are more than 1,500 workers there, and on the level of each community there are centers working, we can see the differences. If we take Kharkivska Oblast and Lvivska Oblast, you know, I cannot tell you that the concepts are different, but the approaches are truly different. And as of today, the standard of the resilience service is worked on, and no matter how great the services are created, we have to agree that training the specialists is the most important thing throughout the process to make the right standard that will work, and so that the workers in the resilience centers would have systematic approach. And it's possible to do that only when you provide trainings to them. That's why I want to thank UNICEF and the World Health Organization. We want to thank for the trainings and training courses because these trainings are highly important. Also, we've implemented the training in partnership with the Ukrainian Catholic University. There will be online courses, and we will provide more than 300 specialists these trainings. And we're also saying that all these online courses should be recorded, posted on the platform, and people have to learn more about them so that all of that would be proactively shared. We understand that these days we have to say that we have to have the organizer. I mean, a person who has to manage this process, to be the case manager and implement and organize the work in the resilience centers. Also, there has to be the specialist in social work and psychologists. According to statistics, we can see that we have more psychologists these days, more than 300 case managers who are the organizers of the working process, the social service workers, there are more than 500 of them, and more than 700 psychologists. So these days we are emphasizing the fact that these trainings are so needed, and we are actively implementing that thanks to our international partners. Thank you, Inna. This systemic vision at the service and training of specialists makes it possible to speak about sustainability and quality of the services provided. It is so important that right now you started speaking about standardization. It's not an accidental worker who got a job. It's a specialist, and this area has the understanding what competencies this specialist should have. About the competencies, education and professional development of specialists, we had to talk today with the representative of the Ministry of Education and Science, but unfortunately Mykola Trofimenko couldn't join us due to the governmental meeting related to higher education. discussion, but right now the Ministry of Education and Science is working on the implementation of the regulations to the specialty such as psychologist. So we will say that the requirements to the preparation of psychologists as specialists of mental health, like all these requirements will change, including the fact that all these requirements will impact the quality of professional training. The new law on the system of mental health tells us that mental health specialists will have to be certified, and it creates new requirements for the trainings and preparation of specialists. Actually, it may lead to the increase of the quality of services. But speaking about the specialists and mental health services today, it's important to say about veteran sector. These days, work with the veterans is actually not just about working with specific target group, because veterans do not walk along special corridors. They live in the communities, they go back homes, and they go back into their families. And actually both the veteran or well, the veteran has to adapt and the community and society has to adapt. It's the double-edged sword, and this is the process that requires interagency approach, interaction, because actually it is so painful and so scary where people with combat experience, they bump into the closed doors where no one hears them. I know that the Ministry of Veterans Affairs works a lot to ensure the smooth transition among the sectors. So Julia, please tell us what works, what achievements do you have, and what difficulties does this area face? Hello. First of all, I'd like to thank you for the invitation. For the Ministry of Veterans Affairs, the topic of mental health and the return of veterans into civil life is one of the key priorities. This is something that everything starts from. And the veteran policy itself is cross-cutting and it overlaps with different areas, different sectors. And that's exactly why we're building all the processes in the way that the veterans going back home would feel this support in all the areas, on each of the stages of their lives. Let me start from the very beginning. From 2022, from June, if I'm not mistaken, we've launched our crisis support hotline from Ukrainian Veteran Fund for Veterans. By the way, it's also one of the hotlines, and it's a part of the mental health program named How Are You? We want to thank you for the cooperation and the recognition of this work, because let me pay attention to the fact that the main psychologist, the head of this hotline, is a veteran who, after returning to the civil life, realized that this topic is very, very close to him, because for a long while this veteran has been going through the rehabilitation, then trying to support his peers, and he entered the university, studied, finished his education, and now is in charge of one of these hotlines. It is 24/7 hotline, and there are a lot of calls. And these days the families of the service members who died also call us, and for us these are people who truly deserve separate attention, and we launched for them the support groups for those who are grieving, and a lot of women and men who were in these support groups, they also became service providers. Recently, the Ministry of Veterans Affairs launched the project. We contracted the mental health service providers all over Ukraine. We have more than 250 service providers who provided from the beginning of the creation more than 30,000 consultations. And this is a high indicator which shows that the trust of the population and the culture of veterans and their interest in the psychological services is going up. Now, in terms of the intersectoral cooperation, you know, it was a really important priority for us, so we launched the 3-level program, which is stipulated in our order 1338 about 3-level support system. The first level is social psychological support, and here the veterans get the services from the supporting specialists, and in November we celebrated a year uh, anniversary of the work of these people. They provide crisis support and help the person regulate own emotional condition and help the person find the right specialist. And here it's also about the support of social workers and other service providers in different areas. And the second level is the service providers.
So what was interesting is that all of the services providers are working at the community level, and we are frequently involving them to programs that refer into the job employment of veterans. Because what we saw is the support of mental health for veterans at their places of work or the collectives where the veterans are working is also, and then it's key of their finding the senses of their own understandings and getting back to that full scale life. And this third level is the experts that are working into multidisciplinary teams so that those services and this interaction to be more of a, let's just put it that way, accessible and inclusive. We are launching also not only through our offline services and the network of offline services, but also launched the platform Veteran Pro that also veterans, male and female, would be able to find. And so now they can find their own expert and support in every community that will refer them. And then soon enough, we'll finish the development of our digital instruments so that in a way we would be able to find, say, psychologists in their community, in their region, or in another regions where it will be useful to them and where they would like to get those services. And so that each area of work would have an ability to, in a quality way, to work with our protectors that are getting back or with their families. Today, our Scientific Research Center Borodyanka is conducting classes for such experts. So we are teaching them our experts in support and centers for veteran support, and we are working with the community and international organization to reinforce those experts in different areas of work. At the beginning of this year, we launched contracting for family doctors that we are co-paying for an advanced package of services for veterans. And for us, it is important to conduct training for such people as how to correctly work with veterans and then to whom it is needed this kind of support. Please reach out. Our center Borodyanka is always ready to get everybody and to help everybody. And I think I can say about the important component we are speaking of in a strategy for veteran policy. There's 3 strategic objectives. The first one is workforce potential, human potential. The second is the support, and this third one, which is the reinforcement of capacity, because veterans are the capital that is helping the country to stand up in 2020. But if you speak about the first thing, about the human potential and workforce potential, one of the priority is the recovery of physical and mental health. And it's impossible to feel fully if you don't have your own area of work or your other areas where you would want to develop And because of that, when we are working in the area of employment or the support of veteran business, the part of mental health for us in those areas of work is extremely important because not just veterans are supposed to adapt to the civilian life, but civilian life and workforce potential, they're supposed to be ready to take those people in. This is why we are working the implementation teams. We develop methodological recommendation for the employers and how to get back veterans to working places. And also we launched the implementation team so that we can help the employers and to the workforce people to adapt to changes that exist right now in the society, and also to we are not only the HR teams are working. When we started to work and we understood that we won't be able to move forward if we won't have the involvement of our expert of psychologists and all of that. This is why it's important in key areas of work that we are working on the decrees that will be employing this intersectoral cooperation. And to what extent, when I prepared, then they told me that they are, and soon enough, it will be taking on the government level. Thank you so much. Julia, thank you so much. You really, when you shared your experience of your area of work, it's sort of like you're building a basic inside of the system, and so you're having this intersectoral, and then it was about business of the veterans and their involvement and the employers as well. And so you're succeeding in doing that. And then probably right now, intersectoralness and then the referral system is the most painful matter if you're speaking about the big system and different areas of work. Uliana, the question will be there to you because you're in today's panel is a person who has this intersectoral experience of cooperation. You've started your path in the policy making in the you're now working in the use area of work. If you could have allowed us to dream a bit and to imagine this ideal system for referral, if the transfer between the areas is would be as painless as possible, what would be your opinion then? Thank you, Anastasia. I welcome everybody, all the participants, male and female. And I would like to sing to the team so that all of us would be on the same page and for all of us to understand what is happening in the area of forming of mental health. And it's very important from talks like that, from big topics. This synchronization starts this intersectoral cooperation, and we can develop this interaction in anyhow. And therefore, we are grateful to Oksana and her team, and to a person that's started up these initiatives, to Olena Zelenska. And I think that we already can assess what are the results we have. And so, if you remember our first meetings, then my dearest friends would not allow me to lie that there was not so many positive news where we could provide people support in mental health. And right now we are building the networks of services provision in mental health. And this is extremely important. And I will be answering your question, Anastasia, if I may, in terms of use, because this is the target audience at which I am working at right now, and therefore I would be looking at this with eyes of the youth and the intersectoral cooperation. And I do remember Viktor Komarenko that is present here today, and now taking care of mental health of our military personnel. He went into community where I lived at and built the public services in the Mariupol, for example, and told us like how does the brain of a person is formed and to what age the youth has the ability to have this knowledge and skills and knowledgeable enough, and where do we have to be careful was our expectation from our youth. And independently from the fact that we think that youth is flexible, they can take everything upon themselves, and we don't need to take care of them. We really need to. And I'm grateful to every sector that is taking care of mental health of youth. And so right now, I have formed this in a way, those like hints, and how can we build this interaction. And the first answer that we have to, first question that we have to answer: do we have enough experts, and do we have experts in mental health altogether, so that we can work with the youth and with other citizens of Ukraine? So, for example, we have a bit more than half 700 youth centers in communities throughout the country, where more than 1,500 youth workers are actually working at. But out of them, there's only 18 psychologists out of those 1,500. There are volunteers, there are partners organization, and so how to respond to requests in the support for mental health of youth through partnerships, through, and those 440 and more youth centers, they have their own programs in mental health. And I asked some of them, so what are you doing actually? And they looked at the side of the social policy, and then they said that they're cooperating with the resilience centers a lot, and then they're basing off of the psychologists that work in there. Somebody are integrating it in veteran policy, and if the youth centers and spaces are working with the young veterans, then they are using the support programs for mental health that are present there. And of course, the centers for mental health that are now being built by the health system as well. And it's an important part of the structure, what is done by the NGOs, the specialized services for the support from the domestic violence hotlines, school psychologists, because youth is 14 plus and they're still at school. And so we're looking at teenagers as well. So this is an enormous infrastructure that is supposed to be now known to our youth workers, and they need to understand like who is there and who is working with them in communities. So because without this information, without this knowledge, they can't move on, and they can't refer the youth that needs help, or are saying that, oh, I need support, my mental health really needs support. I wrote down this to me one before the last one, but I really like to highlight this here. This is the peer-to-peer program. There has to be the circle of trust, and all the research that we're looking at right now is saying that the youth is not really trusting to somebody who is outside of the circle of trust. So the same teenagers or youth or friends or known like close ones. Unfortunately, COVID and the full-scale invasion has strongly influenced into the socialization of our youth. So they don't have that many friends, they don't have that many people that they trust, and therefore the youth centers and spaces is such an important point of entry for youth and access of to the mental health. And I am looking at everybody with the fascination, because there is a big community of who is taking care of mental health of Ukrainians. Look at the youth centers and youth spaces to know that they are the point of entry to mental health of the youth. So what else do we have to know for ourselves? This is that the every expert that are working in mental health, they need to understand the framework of responsibility of all the sectors. Unfortunately, so many experts in communities are making a mistake by mixing the capacity or opportunities, for example, psychologists or social workers or resilience centers, those providers that are working with in the area of veteran policy, or for example, the ones that are working in health facilities, mental health centers, and psychiatric care, for example. They're waiting for people to do something that they can't really give. But if our experts on community level would understand like who or what can do and can how they can be helped, then this quality and the effectiveness of this support will grow tremendously. Well, another thing, so all the experts, they're supposed to have the protocol of work and the support of mental health for their target audiences, and then to go through instructions And this instructions has supposed to be given not just that, okay, protocols exist, and also on the infrastructure of mental health, on support of mental health, on the algorithm of referrals. And it's a fantastic results that we have because of the plan of activities that was approved by the government, and then to development of which everybody has joined at a time, and that was coordinated by an enormous team of coordination center. And then there a lot of attention was given to the protocols, to instructions, so to those things that the experts are taking in their own hands and that they're working with. This is extremely important. We in our ministry, and we've taken in order that would regiment the processes of referrals and then the support provision in mental health. But is this enough? It's not enough. We can tell you right away. I'm not shy in speaking about issues, and when we are asking about our experts in youth work, not all of them know that there are orders, that not everybody's are implementing those instruments in their work. So here I would agree with enough for 1,000,000%. So training is extremely important. And the fact that Yulia was the team are doing for expert for support of veterans, this is also extremely important. So we all have to give the skills and knowledge and the protocols and algorithms. We can call them anyway. We want, by the experts in the community, they need to have something to get off of. The one before the last one is this digitalization, and I think that in Ukraine, there's nothing more simple than to speak about the need in digitalization or the instruments in that. We are actively moving in the area of work, but if we are not connecting all of the support in mental health into one singular system, and if you're not going to create the instruments for our experts in community level, it's going to be really, really hard on them. An enormous line of work done by regional coordinators that are working in the mental health area work, and they're gathering everybody, they're synchronizing everybody, and everybody understand like how every sector is working. But there are human factor. People are leaving, people are changing, not always the resources sufficient. This is why digitalization, I think, this has to be the objective for every sector, that is a result will bind everything into this singular structure of understanding like who is working where and how. In addition, the last thing that I wanted to base upon, this is the quality monitoring. If you're speaking about the intersectoral cooperation, we need to honestly, from time to time, look at the results of our work and talk to the ones who are building this health systems with, and then have the service reached you. Have you received all of the needed support for to feel yourself more sustainable, more safe, to be more capable in living, working, taking care of yourself and your family. And in reality, if such a monitoring is not going to be done, and we are not going to be saying what's not working, then we will be just painting a nice picture, but we're not going to have a result. Therefore, in the area of use policy, we are starting to do this big audit, and we are going to look at where the support is lacking by experts in the community levels, because they can do more. We will be supportive of them in that, because this is an enormous load. And we will be grateful to every sector if you would be open to cooperation. And then you are doing this already, but if you will be continuing to do that together with us, so that every young person in Ukraine from 14 to 35, this is our area of responsibility, would be in their community, hoping for the support in any kind of hardship. Thank you so much. Thank you, Uliana, and I would say that this is systematic analysis, so we need to let Katerina go for the next meeting, but thank you so much, Katerina, for the participation in the panel. And then, Uliana, if we are to get back to your answer, and it sort of takes out that the secret of this intersectoral coordination and cooperation and knowledge ness of the expert, understanding the sides and the algorithms, and in the flexibility and readiness to hear each other out and to be honest in what we have and what we don't have. Yes, it is that way. And then the secret is for us as the government organization, as the people who are answering for each and our sectors, would be taking care of the ones who are taking care of our youth, our veterans, our military personnel, and on and on. So that support ones who are supporting others, and I guess to support also one another. So the ones that are building policy, the ones that are making policy. Thank you all so much for such a palette that has been in our discussion in the panel. And so when we are having only 3 minutes left, and if we have mentioned about the support and about the ability to hold, I would just continue the tradition of Olga Horbanyova that she started in her panel. And I will ask you blitz questions. So what is helping you to hold on? Yulia, if you can start with you. So I feel like probably my team to hold on and people who are nearby, because without their support, I would not be able to hold on. We are trying to support one another, and the most things that are helping when we are going into the regions, we are frequently having meetings with the veterans, and what is supporting us is that we are, yes, speaking about the issues that are in existence, and it's important for us. But when I'm hearing the success stories that something was able to be done and we were able to achieve this, for me, I guess this is the most important thing. This is my treasure that is helping me daily in my line of work. Thank you so much. Edna, can you share? I also do agree that the first things first, this is the team that you're working in, because maybe you can live as anything when you have the trust, when you have the understanding of what has to be done, how it has to be done, and when you have a support of what you're doing. And of course, this is when you're going on a work leave. This is the amazing superhumans or amazing people or humans that you have such an atmosphere. You're just entering there and you just want to be a part of that and to get this positive feedback and emotion, and so this atmosphere, so that it would go into another centers, so that everybody would take an example from what we have to have as that we need to cover, and how does the timely support has to be provided, also mental health support. And regarding me, and I just remembered, we've been in the Dnipro when we opened the Resilience Center. And this was about what was I mentioning when I entered this center and I got in depth, and there was such a metaphorical maps, and I saw a girl in the forest that was running, and I shared with the ones who were present at that time at the table that for me, recovery is running. And I have opened for myself the morning runs, the weekend runs, and this is an ability to be with yourself, to be with your thoughts, to be present, to be mindful, to recuperate, and then it's also work upon yourself when you're becoming a different kind of person. And when you understand that this kind of meditation, this kind of exercise is helping you to hold on and is helping you to be better, to be a better human being. Oh, thank you so much. Oliana, was one sentence. Oh, this is going to be hard. And right now, today's my support is the picture on my phone. And I think that many people right now in Ukraine are gathering to such a support from their relatives. And then it's extremely important to understand right now that you can be a better version of yourself and to do something extremely important, and then to be useful to people nearby, to your country, to your people, and the places where you are at. Thank you so much for this honest talk, and thank you so much for inputting so much into what you're doing. Let's support our participants with the round of applause. Oh, thank you so much. Thank you, and the applause might not go down. Thank you so much for the talk. And I do see that everybody just inspired after your presentation, that it went well. So thank you so much. So, ladies and gentlemen, so during this discussion, we have heard the vision of ministries on the development of the system for mental health, and then the potential of the workers in mental health areas who work in all of the sectors. And of course, we need to remember that one of the key elements of the support of services providers is the presence of the instrument and resources. And specifically about that, we will be speaking of the next hour and the next panel discussion that has a name: Scaled Psychological Intervention, a resource in the hands of every expert. And so you can applaud. This is the something that is present there. So we are welcoming Svetlana Kaminska, scientific worker of the Psychiatry Institute of Kiev National Institute, named after Taras Shevchenko, and Oleksiy Kovalevsky, a veteran, the leading expert of the Psychiatry Institute of the Kiev National University, named after Taras Shevchenko. Irina Smiyanenko, psychologist of the Resilience Center of City Vilnohirsk from Dnipro region. Kristina Pankiev, psychologist of Mental Health Center of the Nadvirny City, Ivano-Frankivsk. Daria Pashin, coordinator of projects and the trainer of the Coordination Center of All Ukrainian Center volunteer. And the moderator of the session will be Hanna Lehkova, the expert in psychological interventions and WHO office in Ukraine. Thank you all so much for being here, and thank you, Anna. I'm passing the floor to you. Thank you so much, Timur. Today we have like simple and not a simple panel at the same time. You overheard about the scaled intervention or scaled up intervention, but we would just like to start not from the technical, not from the instrument, and then the talk about the questioning. Therefore, I would just like to ask in the hall and whoever's joined online to take off your phones, and then we have a QR code that we will ask you to go to and to give answers to the question. The questions will be really simple, and on the end of our panel, therefore I'll ask you and honestly answering them. So just to place a few buttons, and that's it. There's nothing hard or complicated. So we are going to have two questions. Quite simple. Who is online with us, they can also join in to this survey. And the first question looks like, do you know or do you have at least one technique for the stabilization of emotional state and reduction of stress? Yes or no? A very simple question. Did everybody manage to go there or to get the QR code in? Just get the QR code back for us, please. Oh, thank you all so much for being active, and whoever's answering this question, thank you so much. I see that you're filling it up. Okay, 164. Great numbers. Thank you all so much. Just a bit more waiting, a bit more waiting. And we have a following question. Do you use those techniques regularly or not? For a support of your own mental health status, also a very simple question. Are you using those techniques regularly for the support of your own mental health?
I'd like to remind you that we will get back to the results of this questionnaire at the end, and at the very end you will receive a gift that you will be able to take back home with yourself. So another 30 minutes. Let's wait a little bit. Thank you very much, everyone who provided answers to these questions, and we will proceed with our panel regarding scalable psychological interventions. One of the key components, as Timur has said, is support for service providers using the available tools and resources. Before giving the word to our speakers, I would like to elaborate a bit on scalable psychological interventions. Everyone can see the picture now. We prepared some pictures and I will be describing it. Psychological interventions are available support for people who are going through something hard, for example, like diseases, trying times, difficult life conditions. We know that not everyone needs specialized care. Some people just need short-time interventions in order to get that support and to be able to manage their life on their own and got their resources back. These interventions can be applied separately as standalone interventions, or they can be integrated into other types of care. We know that there are individual and group interventions, and they are helpful when a person experiences constant pressure, burnout, loses motivation or hope. Yes, in fact, these interventions could be those much needed techniques for the specialists. These are certain actions that are evidence-based. For example, CBT, mindfulness, ACT, and they also include the tools of behavioral motivation, relaxation, stress management, and also motivational strengthening. When we are talking about scalable psychological interventions, we do not only strive to reduce the intensity of the symptoms, but we want the person to restore their functions and improve the quality of their life. You know, for specialists, it is really important to have protocols because structure and protocols, they provide that pillar on which they can rely on. This allows specialists to better organize their work and being focused. This protocol or structure protect the specialists from burnout, and they provide more confidence about their actions. So specialists have the tools and they know how to help people better, and these tools are beneficial not only for the clients, for the service users, but also for service providers. our service users and service providers can receive that kind of support that when they struggle on their own. It is also about gradual recovery of internal resources and gaining practical skills. Interventions, they bolster and teach people to cope with emotional storms, difficult, overwhelming thoughts, effectively solve different life situations. Also, they stabilize their condition and give them back hope, and they also teach them how to treat themselves and others in a kind way. People who feel burned out and have depressive symptoms should restore their activities and social connections. We remember that psychological interventions, they are integrated with other tools, and we would like to show you the step-by-step approach, which means that care is provided gradually and it's based on people's needs. At the very beginning, these might be very simple interventions like a conversation or some guidance or self-help techniques, but if this is not sufficient, then we proceed with the next step, which provides for some certain tools that allow to cope with the struggles. The step-by-step approach is about the needs of the people here and now. Support for the person starts off with the preliminary assessment needs in order to identify what kind of intervention a person needs at the moment, and potentially a person might need, for example, what matters in times of stress. This very intervention contains a lot of useful and simple exercises which are beneficial to people who are stressed out. They can use any intervention during 30 minutes and they will be able to get more resourceful if we do it regularly. It is also important to repeat the assessment, which we do at every stage of the step-by-step approach, for us to better understand how to move forward, what kind of interventions a person might need further. If we proceed with step-by-step approach, we have self-help plus at the second stage. This is another group intervention that combines different effective exercises that help us live in the present, live according to our values, act remembering about our values, no matter how unstable the life situation is. Again, we do the preliminary assessment needs and we will proceed with step number 3. For adults, we can use individual format, which is the problem management plus. This intervention is for adults, where people learn how to solve complex, challenging issues step by step. Of course, they will not be able to settle all the issues they have, but they will be able to do it gradually. They will be able to shape their support network, reduce the isolation and go back to their active life. For example, speaking of adolescents from 10 to 14 years, we can use the intervention ease, which is a short term intervention which allows the teenager to understand how to better cope with their emotions. And it includes not only some simplistic exercises, but also, engage as parents in order to strengthen the support for the child at home. It might happen that all failed and the person did not achieve the necessary result, and only then we refer our people to receive specialized care. So these are available tools and resources, but I would like to proceed with the conversations with our specialists who use these interventions in their practice. And I would like to start with the doing what matters in times of stress, and I would like to give the floor to Svetlana Kaminska. Could you please share your experience of using this intervention? Thank you a lot. Thank you for chance to be with you. We, Alexei and I, represent the Mental Health Center for Veterans and their families within the Shevchenko Kyiv National University. In our university, there is an ecosystem space where specialists, researchers, practitioners are looking for the ways and tools to support people who have gone through complex and difficult events in their life. One of the approaches for me personally was the intervention by the WHO, doing what matters in times of stress. At first, I encountered it as a specialist at the WHO training, but it became my pillar of strength very quickly. From the beginning of the full-scale invasion, I lived 3 months under occupation in Kherson. We spent the nights with our children in basements. We did not have power supply, water supply. Then we had to leave the occupied territory through Russian checkpoints, and we were leaving the occupied territories with the inscription on our cars which read children. And I was beyond happy when I saw our military personnel, and the first thing they asked us to do was to remove the white stripes from our cars and the inscriptions children. Then we had to relocate to live with our relatives in different places, and then we were of course worried about our parents who stayed behind in the occupied territory. My husband decided to join the army in order to combat the evil. And later, my child was diagnosed with PTSD, which was another challenging period in my life. And back then, I self-referred to doing what matters in times of stress as a mom, not a person, not a specialist. And those simple exercises helped me to hold up and to support my family, my children. I realized that I could also use them when communicating with children, people around, because they do help reduce anxiety, combat difficult thoughts, and get back to yourself. These skills are suited for everyone. They are easy to use. They do not need any adaptation, adjustment. They are really effective. They allow to feel more strengths, and they provide you with the sense of willingness to live on, even despite all the hardship. We are learning to observe ourselves, to keep calm even when the storm is raging around. We are learning to find that strength inside yourself when it feels that you are running on empty. I can see how these skills work, and we use them daily in our work, and they are beneficial not only to me but also to the people around. We learn together to breathe, to stop, to observe what is happening around us. That is why we decided to integrate these skills into our work with the veterans and their families in the center. They became a crucial component of the equation when it comes to support. We saw how people started recovering, how they got back their hope. So thank you very much for the opportunity to become a part of this work. And I would like to give the floor to Alexei. Hello. Thank you for such a chance to take the floor. I'm a veteran. I was serving in the 3rd Separate Mechanized Brigade. I was injured several times. I had concussion several times, and I would like to share my experience. It was 2022, we were deployed in the Kharkiv region. We were liberating Izum. There were constant battles, shelling. There was the smoke all around. Everyone and everything were shattering. I had some combat experience, but my life changed drastically after that event, as it was the 2nd severe concussion. We were at the positions when the Russian tanks started shelling. There were 10, 12 tanks in that direction, and they could shell one position. The round was launched, and then you understand that it was targeted into you. And one of such rounds hit our position, and I realized what it is to get lost for 1 minute, 2 minutes, 10 minutes, an hour, and you really needed to get your wits about yourself. I do remember this taste of metal. I had a nosebleed, and that taste of blood was horrendous, and we needed to cope with that despite all the chaos around. I did not really understand right away whether I survived or not, what happened. And back then, at that moment, I started looking for my belongings, because it is the most terrible thing when you lose your rifle. I realized that I did not have my helmet, my bag, and I started looking at it and observing the area. Then I saw my helmet 5 meters away. Then I saw my rifle, and gradually, slowly, I started to realize what happened. And when I saw all of that, I understood that the focus on certain things gives you the sense of the here and now, and you feel grounded. Then I realized that I needed to stabilize my breathing, because I had a very speedy heart rate, and I started breathing in with my nose and out through my mouth, and I realized that I was in the present time, and I started just coming all together, and then I had that perfect clarity of thought. My brothers were around, we started supporting each other, and when I stabilized my breathing, I felt how my heart calmed down. Over the course of time, I'm already a civilian, and after having participated in the WHO program doing what matters in times of stress, I realized that back then in the battlefield I had already used those exercises subconsciously, unfortunately. Back then I was trying to pull myself together, and now I know how it works, and the most important thing is that these skills give you the sense of control, and they allow you not to lose yourself when everything is crumbling around. These are easy actions that can be beneficial to everyone, to military personnel, to civilians, and even now, if there is a strike and it often, or for example, if there is a loud noise, military personnel treat it as a trigger, even if someone shuts the door, and you start trembling, but then you look around and name the 5 things you can see, 4 of them that you can touch, then 3 of them which you can feel, and the ones that you can taste. This allows me to prevent the past from consuming my present and the future. I would like to recall another memory from the combat experience. After having liberated the Kharkiv region, unfortunately not the whole settlement in the Izum settlement, but we were deployed as the strengthening forces to the Donetsk region. We had to storm the small forest. We gained foothold. The battle was really challenging, but there were no losses. I was serving in the reconnaissance unit, and we had again to engage into the combat. And after that combat, I just sat under the tree. I opened a bottle of water and started drinking. I do not know what about tomorrow, but back, I started sipping that water. I started tasting its flavor. It was a bit cold because it was autumn, and the feeling of how it goes down your throat gave me the understanding that I was alive. I was in the here and now. Of course, after that, I again started to stabilize my breathing and managed to relax. Back then, I understand that I was alive. Back then I did not realize it on the conscious level. I was not aware that this technique had a name and that you could do it again. But after having undergone the doing what matters in times of stress, I realized that it was not by accident. That is the technique that allows you to get back the sense of control when the chaos is around. And that was the conscious drinking. I've been in the civilian world for 2 years, and I always and often make use of this technique. So every morning, I think that everyone here drinks water or tea or coffee. I also brew coffee without milk, without sugar, and I start observing the light which is shone on the cup. I breathe in the taste, the flavor, and start sipping on that coffee as I did it with the water in the Bakhmut area. That is my morning ritual that helps me to gather my thoughts. And during these few minutes, I am in the present without the past lagging behind, without the combat experience. These are really enjoyable moments, and this experience is not only about my memory but about the self help practice when the body and the brain was in the survival mode. Now I use this in the civilian life when anxiety overcomes me, when pain in my body reminds me of the injury, or when nights are too loud. I just keep breathing, observe the world around, and I repeat to myself, when I'm sharing this story, I am often asked how to keep calm during strikes, but the thing is not about calmness, but about the ability to hold up when the world is crumbling. It is your ability to stay as the whole. It is like nature. I would like you to imagine the storm around on the left. The wind is blowing, branches are broken, and you are sitting on the apple tree, and every blow is a threat, but as you get down closer to the ground, it gets easier to breathe. So these skills are equivalent to this, they do not change the weather, but they help you to gain that solid ground under your feet when everything is shaky around. Even when the storm is grinding on and on, you do not only hold up, you grow together with the life in order to survive. Even during the wartime, during the combat experience, this what can save anyone. You do not need to live through a disaster or a tragedy to learn how to breathe. Just when you drink coffee, and when I think back to that concussion, to blood and all that, I do not see a tragedy, but I see that moment when I felt myself, and I know that even after the darkest night, there will be a bright morning, even if the day was hard and I feel overwhelmed by some memories. I have a tool which helps me to get back to this life. This is my awareness, consciousness, and coffee, and my important skills. Thank you very much for your attention.
Дуже дякую.
Thank you so much, Svetlana. Thank you, Oleksiy, for your sincerity and for your courage to share your difficult personal story. I know that it is very difficult not just to share it, to record it, and then to share it again. This is very, very difficult thing to do. So we sincerely appreciate all that you do. And the intervention Doing what matters in times of stress is one of the options how this intervention can be used and how it can help impact the life of the person and the life of the specialist. But the particularity I do agree with both Svetlana and Oleksiy is that this intervention can be used by anyone, anywhere, in different sectors, in different services. It can be widely used. Next, I'd like to move on to our second stage. We remember this multi-step approach. I'd like to give the floor to Irina. She will share her experience of providing care, and she'll share her experience as a specialist, how Self-Help Plus impacted people she helped, and how it impacted personally her. Irina? Hello, I'm a psychologist of the Resilience Center of Vilnohirska Territorial Community of Dnipropetrovska Oblast. Every single day, I am next to people who go through loss, anxiety, and uncertainty. And it's not easy to be next to people whose world is being destroyed. When I first learned about the Self-Help Plus intervention of the WHO, I felt something practical about it. You know, the tool which can help me better support the residents of our community. I didn't try to find the changes for myself. I was trying to find the foundation, the pillar to be helpful for others. And this intervention has a clear structure, clear protocol and action plan which ensures safety, both for me and the participants of the intervention. You know, we live in the times when the war doesn't give us stability, when everyone is tense, when people are in the long-term stress, when everyone can be overwhelmed with emotions and feelings. And it's so important to have this space where you can simply be without expectations or judgment. So the intervention starts working in that moment, transforming people, returning them from internal tension into the condition, as they say, here and now, the condition of stability, control, and presence. And in the group activities, there is a chance to observe people when they work on these skills, these techniques, and you can observe their transformation, true transformation. You know, some people simply open up and start talking. Others start smiling. Somebody's voice becomes more confident, and somebody may simply say that he or she finally felt calm. And that's the moment when I feel calm. You know, when I worked on not very usual format of this intervention, on the structure of this intervention, I didn't notice how much I changed myself. I started treating my emotions differently. I didn't put them down, inhibit them, or resist them. I lived through them. I became kinder to myself, and you know, even my family noticed that. There is a very, very powerful phrase. The intervention that I want to share with you has it. Change what can be changed. Accept the pain of something you cannot change and move according to your values. This is the guideline, the beacon for me, which gives me a chance to be in harmony with myself. And now I'd like to share one of the participants' stories. It impacted me profoundly as a facilitator. A woman comes from the resort and she finds out that she was fired from the workplace where she had worked all her life. And instead of her, there was a woman whom she trained for a year. At home, the mother is low mobility woman. The father died a year ago with the suicide, and the daughter is silent and she doesn't talk to her. The pain she came with, I felt it even without her saying a word. And I thought, oh my God, how can I help you? She was sitting there quietly, depressed, but she thoroughly performed all the techniques of Self-Help Plus. And in 4 weeks, she came back with a new hairstyle, in the new outfit. There was some makeup on her face, and it wasn't just me who saw all these changes. All the participants of the group saw the changes. They were quiet for a few seconds and looked at her. And in 5 weeks, she said that she didn't change. She simply remembered who she used to be. And these words become the pillar and they give the meaning to my work. I want to sincerely thank the World Health Organization, the Ministry of Social Policy, Family and Unity for the participation in the transformation of not just the citizens of our country, but of me personally. Thank you for your attention. Thank you, Irina, for sharing your sincere transformation story. I cannot find different words to describe that. The transformation of not just people thanks to this intervention, but your own transformation. Then again, the scalable intervention may be applied in any sector, but it perfectly fits into the services of resilience centers in the area of social services. Thank you so much. Now I'd like to give the floor to our next speaker, Christina. She works for the Mental Health Center. Christina, we'd like to hear about your personal experience on providing care using the individual psychological intervention Problem Management Plus. Hello. Blossom where you're planted. I'm a clinical psychologist of the Mental Health Center of the hospital, and I'm the deputy head of this mental health center. I'll share with you some information about the program, which has become an important working tool for me and the tool of my pillar. Every single day I face different clients, patients who live in very difficult situations with mental health disorders, pathological, psychological syndromes and symptoms, and a lot of other unresolved issues. Why I say patients and clients? Because once communicating with the veteran, I told him that he's a client for me, explaining that the patient is a person who's suffering. And he asked me, aren't I suffering? Don't I suffer? And I said, yes, you also suffer. That's why I often say both words, clients and patients, since I work in the hospital. And this program, the program of the WHO, the psychological intervention, individual intervention applied in the individual work, it is named Problem Management Plus. This is an important program, not just in my work, but also in my life. You know, I learned about it in the training of the WHO in summer this year. Back then, we were working on a very important project. And unfortunately, right now, I cannot tell you what this project is, but it's important we participated in the international grant, and luckily, we got it, and our project is being implemented, and maybe later I'll share more details about it. So this training has supported me, first of all, as a person, as a specialist. And later, it became a great tool in my individual work because I could see the results I didn't even expect. So this program is about the fact that the person learns how to overcome own difficulties, becomes an ally for herself or himself and gets the tools to solve problems, manage them, not chase them away. You know, you will always face problems, but the person becomes own observer to share and to divide these problems on smaller pieces and eat that elephant by pieces. So, and as a specialist, I'm not the person who is solving problems and giving advice. I'm a person who is supporting, not holding the hand, but just accompanying the person. It's important because it shows us that we can be helpful regardless where we work, be that in a big city like Kyiv or a small city like ours, Nadvirna, because professionalism has no geographical boundaries. Today I'd like to share the story of one patient who came to me with severe hatred to her family, and all the time she was crying. It was a challenge both for me as a specialist and for me as a person. And I'd like to highlight that the supervisions helped me a lot because my supervisors supported me on each step of this difficult way. For this program to be evidence-based and so that I would follow the protocol, which is highly important and my favorite part of this program because it is structured and it is a whole protocol and professional evidence-based, and this protocol takes care of me and takes care of the person asking me for help because this way the person gets good quality care. So the patient came to me with severe hatred to her family and with the desire to change them. And you know, a lot of people think that if their surrounding changes, the attitude to them changes, then probably their whole life will change. Actually, it was in vain to convince her that she has to change her attitude to herself and to people around her. That's why, as I said, it was a challenge of a kind, but we managed to do that. We started applying PM Plus and the person learned to divide all the problems into little steps which could be manageable. This person stopped believing that she is a part of the interior design of the family. She stopped crying because before that she'd been crying daily and she hadn't talked to anyone, but she started recovering the connections and she even called her friends that she hadn't talked to for years and she asked for support from others, and it's truly important. Then one of the stories followed, and this story is in my heart. I kind of collected them. The client came to the session. She was very happy. Her eyes were shining, and she said that for the first time I baked bread for my family. It wasn't just a loaf of bread. It wasn't the culinary masterpiece, but it was the symbol of care. She started taking care of her family, not because she was forced to do that or responsible for doing that. She wanted to do that. When she told me how she at first tried to find the recipe, how she was mixing up the dough, waiting for it to grow, and we all know that baking a bread is not a very easy thing to do. So when she said that her family tried piece by piece that baked bread, as if in the office it was getting calmer and calmer, and you know, such moments are worth working and living. This is the program that is true evidence to that. And right now she said that she right now stopped hating. She's taking care, she's loving, she's breathing more openly, and this care, it spreads, it unites, and it shows how important it is for the person to have a person, to have someone to ask for support and help. So this is all about how important it is to be heard, to be needed, to be there for each other. I really want to thank the World Health Organization, the Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine, the Ministry of Health, and all Ukrainian mental health program named How Are You for the participation in such great trainings and for the tools that each of the specialists in mental health gets as the evidence base to provide evidence-based professional support. You know, it is so important because all of us are building the common joint system, the culture of taking care of mental health of Ukrainians, and we have this opportunity to do that. You know, there are always so many challenges we face, so many tasks, so many difficulties, but when we know what it's all for, we will be able to resist anyhow. So thank you for your attention, and keep in mind, blossom where you're planted, because that's the place where you can spread your shine. Thank you so much, Christina, for this sincere, for this open story. And personally, for me, it's not about removing symptoms, reducing symptoms. It's all about recovery. This is the true story of recovery, of not just a person, but recovery of family relationships. Thank you so much for sharing that. Next, I'd like to give the floor to Daria. Daria will tell us about quite a new intervention in Ukraine, which is briefly named EASE. The full name is the Group Intervention for Adolescents on Early Emotional Skills Management. So this intervention is being piloted by UNICEF in Ukraine. It is going through the adaptation stage, and the first participant and the specialist who has finished that training and uses this intervention is Daria. Over to you. Thank you for this opportunity and for this great honor to finish this really important emotional discussion. My name is Daria. I'm a trainer, a social educator, a facilitator, and I represent an NGO named All Ukrainian Community Center Volunteer. For about 10 years, I've been working with adolescents and their parents and specialists working with them. Today, I will speak about EASE, this group intervention, and I will tell you from the position of why this program is so personally important. Let me start. I promised you to share something personal, but I will start from the voices that we hear daily, the voices of teenagers and their parents. Maybe you've also heard these voices. I no longer listen to the music. Before, I listened to the music all the time, but now I stopped. Or I don't want to do anything. I just want to stay in bed and I want people not to bother me. Everything is annoying me. Parents, friends, conversations. When they ask me, how are you? Just leave me alone. I know that no one will want to be my friend in this school. I'm not interested. I'm not important. I talk to him, I look at him, I ask, I explain, and he simply looks at me and is silent as if I do not exist. I know that she skips school. I tried to talk to her about it, but for some reason, it's not helpful. And I do everything by myself. I'm also tired, so what should I do about that? Earlier, with my son, we used to talk a lot, we used to laugh a lot, but now more and more we're quiet. So I simply don't get it. Why? Why does it happen this way? And all of this is not just the teenage age. It's about fatigue, stress, exhaustion, about the loss of beacons and orientation. It's when the teenager doesn't understand what's happening to him or her, and for sure have no idea what to do about that. And parents who are around them simply don't know how to support and help their own children. And sometimes they have no energy and resources to do that. This is the moment when you clearly need the structured and accessible support. This is the support that maybe the psychological intervention is. My personal story and my way to ease started last year, last November, when thanks to UNICEF Ukraine, the Ukrainian office, I had a chance to go to the training and become the facilitator of the training. And then I learned that it'll be 10-day offline training. My first reaction, 10-day training? What will they tell me there? But these 10 days, they flew by. I didn't even feel that there was something not necessary. Trust me, I'm just trying to share this vibe with you. I had a feeling that every single hour was meaningful, and you dive into the meaning so much. I'll be honest right away. You look through the materials and you have this thought, the information materials are way too simple. Will that be enough? Can we actually use that to interest teenagers? Well, of course, it's early adolescence, but there are some teenagers who are 14 or 15. Will it be enough for them? I also had a thought, only 3 meetings with parents? 3 meetings for caregivers? Is it enough? But in the training, I got all the understanding very fast. And when in the group, it was the first training in Ukraine, and the group was really powerful, like whoa, just like the whipped cream of the cake, the icing on top of the cake. And when someone wanted to say something, to comment, including me, like maybe we have to make it more difficult for the wow effect as we're used to in Ukraine. I want to thank our trainers who patiently shared an important message. The importance of this program is its structure. And then, till the end of the training, I understood that probably this is the highest level of expertise where you can use the tool without changing it. And when you do that, the positive changes in the lives of teenagers and their parents are right there. They come and you can see them, you can touch them, you can feel them. In those 10 days, we dived deep, we role played every element, exercise session. We practiced the whole program, and the deeper you dive into this training, the more personally I had the desire to take all this information and materials, run to the adolescents and parents, and see what it'll be like in practice. So at first, we tried it on to ourselves. Although I'm not a teenager, as you can see that for a long time, I tested it all on myself. I keep on practicing them because today a lot of speakers mentioned that, because I am the person who voted for the statement that sometimes I don't have resources to clean the bathroom is the difficult task, but all these skills help me cope with all these difficult emotions and hang in there. And I practice the skills. And when I feel that I believe that it helps me and I can do it in an easy way, that's when I started practicing it. And that's when I saw the impact and the changes in the behavior of teenagers and their parents. And I still see it. You know, it's so visible. You can see their reactions, their words. It is so visible in the way how different participants sit down, their posture, in their glance, because in some moment you can see that their glance, eye contact is more confident, and you can see more hope and understanding there. You know, there are so many stories I want to share, and I agree with everything my colleagues have said, but briefly. The participant, 13 years old, from the very beginning, her mother says, no worries, there may be a situation that she's not going to talk to you at all. She's going to be quiet. She's been like that for half a year. And this girl came to different classes. Yes, she's reserved, quiet. She was doing all the tasks. The 6th session out of 7, she doesn't come. She rushes into the room and she's so happy, emotional. She's willing to share. And she says how that weekend between the session she spent with friends, and she says, I want to have friends. And she shares these emotions and says, I feel better. So these moments, they help us keep going. And the mother who came and she sees and she tells us that my child came back. One more example, a guy, 11-year-old, At first, session of ease, his parents got divorced, the family is going through loss, and the boy is reserved and confident, and we start speaking about ease strategy, change of actions, and there is a breakthrough for him. He doesn't simply describe his small little steps, he draws them, and he sees and he realizes, and the group supports him. He realizes that he is talented, he can see what the guy is doing. He creates different board games, brings them, the whole group plays with them, and the mother comes and says it really works. He became calmer, more confident, and he's more often in a good mood, and he stopped stammering. So we're mostly adults here, and the mother who at the session for parents and caregivers, we spoke about the power of praise, and she said, I understood that I've never praised anyone, even myself. You understand what happened next. Changes took place, and these changes charge enormously. So today I'm here. I want to thank enormously UNICEF, the WHO. Right now I'm the trainer of EASE, and now I help to become facilitators for other specialists. And I have to say that EASE is not just an effective tool built on evidence, structured, clear. It is accessible for specialists. This program doesn't require profound psychological training and preparation. It's both for social workers, educators. This is my personal story. Thank you for this trust and honor. So I'll stop it here. Feel free to contact me. Thank you so much, Daria. You truly reminded me about something I want to share, that ease intervention. You know, why we spoke about it on the third level, on the third step, if we speak about step-by-step approach. It's almost PM+, but for adolescents, for teenagers. We train teenagers the same strategies as adults in PM+. Well, we have no time left. The only thing I'd like to comment on and remind you is that it's truly important to combine all the interventions that we shared today, the experience that was shared by our speakers. Step-by-step approach helps us structure the system itself and us as specialists. And the interventions are not just the tools and techniques in our hands. This is also the resource of ours as specialists. And they can be applied in so many sectors, in the peer-to-peer approach, veteran spaces, education, you name it. The only thing I'd like to say and to share right now is the QR code, because you know there are different task teams on psychological interventions. That's why feel free to open our webpage and find a lot of helpful resources about scalable psychological interventions. You'll see different dashboards of trained trainers, trained facilitators on resilience centers, how many people received self-help plus intervention services. So you'll see a lot of helpful information starting from methodological materials. I do hope that all of you managed to scan this QR code, and I will take 5 minutes of your time. Sorry, I kindly ask to show the results of our survey. What is it that we started from? So, we're so mindful and aware here. 181 people have at least one technique to reduce stress, and only 5 people do not have stress management techniques. The second question. In this case, a bit more than half use regularly these techniques to support mental health, but we need to improve that for you to continue using these interventions in the future. We know that only regular practice, if we regularly do all the exercises and take care of ourselves, because showing care to ourselves, being kind to ourselves, that's important. That'll help you to take care and be kind to others. So a gift for you: if you follow this QR code, you will see different color rectangles. Doesn't work? Let's thank our speakers. And it'll be comfortable for you to scan this QR code, and we'll have to return the previous QR code on the screen. But first, let's work with this one about the task team, right? Let's return the previous QR code. And while you're scanning it, I want to invite you to join the task team meetings of psychological interventions. We are a part of the technical working group, MHPSS technical working group, and the announcement. In November, we'll have our next meeting of the group of the scalable psychological interventions. It'll be all about ease intervention. So if you have some interest left about this intervention, we will gladly inform you about the time of the meeting. All the meetings are online, so all of you have a chance to join us from any place of the world. Thank you, and see you in our next meetings of the task team on scalable interventions. Thank you. Let's applaud to our speakers for their frank and sincere stories. And thank you for the moderation. Thank you, Hanna. Let's applaud to everyone we've just seen on the screen.
Have everybody scanned the QR code? Okay, they didn't have the time, so let's just topic out working group and the first QR code if you can get it back, because a lot of people didn't manage to do that. But the practical ones you were mentioned. Okay, then scan this QR code. Technical working group. We can rest before the final strike. Therefore, we are announcing a coffee break. We are slightly outside of agenda. Then please manage in 15 minutes. We understand that this is not easy. This is a challenge, but we will be able to manage. For ladies and gentlemen, and it's 3:45. We are waiting for you here and again. So express coffee break. Have a great coffee break. Thank you.
І, друзі, давайте так.
Dearest friends, with a great applause, traditionally we will be starting off and make ourselves active and make a loud signal for whoever join us. We would want for you to talk for longer, but there is an agenda. There is some expectation. We can't take too much time so that you would have more time after the official part than to talk to you. So we can move on, and we have just teeny bit sliver of time to work today. And so one of the most widely scaled initiative that has been implemented in mental health in the last years, this is WHO program Image Gap, because of which you can get from your family doctor. And now during the past hour, and then on our topic of the prism of potential and wellness of the workforce. Ladies and gentlemen, we are starting this 6 and the sustainable development of competencies through the sustainable programs and training, the examples of Image Gap program. Welcoming participants of this panel discussion under your applause, Serhiy Obohov, the head of the Workforce Potential in Ministry of Health of Ukraine. So there's Serhiy. Daria Yurchek, expert on integrated services and mental health of WHO Country Office in Ukraine. Orest Suvalo, psychiatrist and a Ukrainian Catholic University, project manager of Ukrainian Swiss project Mental Health for Ukraine. Anna Sayenko, deputy director on the program actions of the charitable foundation, Ukrainian Foundation for Public Health. Yuri Sich, deputy director of clinical interfamily, a family doctor from Uzhhorod City. Olena Kolvodenko, the head of the Center of Primary Care Cancer number 3 of the Odessa city. Victoria Serhienko, pro-dean of the Lviv National University, named after Danilo Halitsky. And moderating this wonderful discussion will be by Irina Medvedchuk, advisor to the Ministry of Health of Ukraine, coordinator of Mental Health Project. For a long list of attention, Irina, please do go ahead. Well, thank you so much, and greetings, dear colleagues, dear friends, dear partners, whoever is present in this audience, and this wonderful, and all the colleagues that are in line with us. And this is a great team of experts from different areas of work that are implementing all of those objectives that we are placing in front of ourselves to preserve the life and well-being of our citizens, because each and every one of us understands well that mental health is an invisible part of national well-being and safety of Ukraine. Therefore, deep gratitude to everybody who is here today with us, who is moving this an important issue forward that recently just has not been an issue for Ukraine. Because we're all used to that mental health, at least it was perceived by the society and many people, many medical employees, that mental health is just psychiatry and that's it. And only now, because of many factors that have catalyzed and been a catalyst for that, and because of the personal initiative and the leadership of the Olena Zelenska, we have made such a strong transformation in times of war, which is not done by any country. And today in this panel, we would just like to talk to you about the things that are forming sustainability of services, that are forming quality of the services and mental health. And we are speaking about the portion of mental health in health systems, about creating space and territory for our expert when they can train, when they can share, when they can exchange opinions and ideas in the training. So the sustainable approach to training, this is not one-time training. We for ourselves decided when we started to scale up this service, and we will be speaking of and the example of the flagship project of the health system that most of us know as MHGAP. This is, yes, those are trainings, but we have decided in a way that trainings are there today. They're done by the partners and donors, but we are looking at future. We are looking at tomorrow. We are looking at how this training, these competencies, and of medical care is all. We will be speaking how does the training becomes an instrument for systematic changes, and the uh, example of MHGAP, I would be grateful. Then we was with just one fragment would show you what kind of results of our joint work today are present in a few years, and also we will remember a bit of the history. And from the 2019 to 2025, we have achieved significant changes, and so we have around 8,000 and a half experts have went through online training, and this is very important for the recovery of our experts. From those 8,500 who were studying online, 4,500 are family doctors, and 3,500 are medical nurses, or 20% of doctors. It doesn't look like a lot of voice training, but this is the critical mass of people who are really changing the system. And what's really important, we can be proud of that. And today, and also to share our wonderful experience the Ukraine has, that Dr. Yarna Kabik is mentioned about this today, which is the scaling up through the online services, online course, management of children and adults with the mental health disorder on the level of primary care is one of the most popular, and we mentioned about this today, but it's worth mentioning again. 142,000 experts have went through the first initial level of that, and when we added a secondary level where there's also a component connected with the pediatric care and health, this is 89%. So 89,000 people overall have finished the online training of the second part of the training. And out of them, 18,000 are the family doctors. This is a tremendous result. This kind of result no country has, and especially countries that are in a state of such an aggressive war, the terror essentially from the neighboring country. And there are results, and the result would be nowhere there if there would not be no people that are working this area of work. And so for me, it's interesting to talk to the colleagues, to say this, to think again, to whoever who's joining, to thank our partners that made this activity possible. And by starting off our talk, I would make a provocation, because the blackout, it's not enough. I would just like for us to think how many of our colleagues who are present here in the audience who went through the course on MHCAP. Can you raise your hand? Online specifically. Great. Not that many, but they're still at this field side of you. Therefore, we are welcoming you to the join with the Academy of NHSU. This is for the primary care mostly, but we have doctors and medics of the specialized care. We have school nurses, social workers, the workers in Ministry of Internal Affairs, and now the experts of military medics from Ministry of Defense have joined in. So we are moving on, and then the first question I would just like to ask my colleague that we are working well with in the Ministry of Health to Serhiy Bohov, that is regarding that today there's many different programs, there's many different training activities, and it would be important for us to have a joint understanding, like what is supposed to be of an expert in mental health, like what is the vision, what is the future plans of Ministry of Health, what is the role of Ministry of Health in providing sustainable and quality training and preparation and essentially training, and integrate those competencies on mental health into the education of medics, into education of doctors, nurses, and whatnot. Thank you so much, dear Irina. I've been in one of the events with you dedicated to mental health as well, and I was told on the image gap, she's answering just like the representative of Ministry of Health. And after the previous panel was emotion, I don't want for my answers to be really dry and off. At a certain point, I do have to dedicate and to know what is the point of competencies is supposed to be had by an expert in mental health. First of all, we need to decide upon who is a part of those specialists. Therefore, one of the projects that are now being processed, that are being aligned, which is the list of experts in mental health, and it's also separated into the certain groups, and so on two big groups. So one big group, which is experts that are the experts on minute of health, and then another one that are not a part of the healthcare system, so are representatives of another areas of work, and military and social and Ministry of Justice and others as well. And so and then the key atmosphere, then they have the bigger part of the control task on the Ministry of Health. That's a part of the Ministry of Health's objective. We need to take the framework and together with the professional community, but we are working on this as the ministry, with our lawyers, and then with the structural subdivisions. And so we have to take this framework to be issued, and then through a bit of time, the ball would be more so on the professional community and on the future, on the regulatory organizations and commissions. And the second thing is the requirements to each expert is on the system for the professional standards, and they're going to be the set of competencies and requirements for the profession for every single profession separately. And when there are employees of the healthcare system, the Ministry of Health will be influencing right away, because right now there's supposed to be improvement process for those standards. If we are speaking about the professional standards from other spheres, then we don't have this regulations there. We can't really we will be hoping for professional standards, and whoever is approving the state standard and regulations for the job profession or the job titles registry. So we really picked an ambitious task for us. When in 2022 we've achieved to scale up the MHGAP flagship program. This is a flagship program of the WHO, and I would not afraid of saying that this was a genius idea at the times of war to cover the gaps that we have for the needs that are uncovered for people, for initial psychological support, to teach experts of primary care for the main approaches of psychosocial support. And of course, the expertise here and the resources and the technical expert support from WHO was enormous, and we are eternally grateful to the organization and to the team for mental health that we worked together with Ministry of Health, and at the time was as I worked as a deputy minister when I started off this work. We had many discussions, honestly. I like to remember those historic moments, but the knowledge of history only reinforces each and every one of us. And therefore, when we started the online course, and we have continued the offline courses, and we can talk about that as well, the challenges were plentiful. The decision was a first time ever made by the WHO team that worked and continues to work under Alisa Ladek-Brezhalova and under Jarno Kabik as well. They've made an enormous assistance to us, and I would just really like to, by giving the floor to Daria Jurczyk, who is the head of the MHGAP area and the mental health team of the WHO. So that Daria would share her internal feelings, since you're working with this instrument for many years, you're communicating with the colleagues, with the partners and whatnot, and I would just like to hear you out in your opinion, what was done and what is done this training more effective? Is the approaches or people or methodology or like a format? Or so what did, given this wonderful opportunity to give the quality, what gives you an ability to work? And so maybe you would share and the examples or experience when they conducted training changed the approaches that experts had to issues regarding mental health? Or thank you so much for the question. It's quite voluminous, really, and then we have a wide experience of the training conduct, and we have a big experience of partners coordination to cover as many primary care workers as possible in an offline training and an online training. And when we are speaking about MHGAP, then right away the first association is that the MHGAP management or the handbook, it's usually in doctor's hands, and then it's developed in a way that it's really easy to use, so that when a person comes to you to a doctor's room, for the doctor to be able to assess psycho-emotional status of the patient, to know what is happening and if the person really needs help in mental health specifically. But after the training, the medical workers are receiving not just the they are also receiving other documents. This is the self-care techniques and also important skills of care for oneself. So they are going out after training with the whole set of instruments that they would be able to use as for the support to people that are reaching out to them, and as for support to them, to their close ones, relatives. And when you're speaking about relatives, this is both family and their colleagues. So after the training, all of those skills are helping not just to take care of the patient, but also to take care of themselves, to medical experts. And after training, there are many shifts in perception of mental health in people. Usually this topic was stigmatized, and unfortunately so, it is still stigmatized. But after the training and during the supervision, because the supervision are going for half a year after the training was done, we are being reached out to by nurses and doctors, and they're sharing those changes that they observe happening. And they're starting to talk that finally we are starting to hear the patient out. We're starting to hear the patient, not just listen to. Usually in medical university, they were taught to give advice, but did not teach them how to listen. And one of these basic skills after the training on the MHGAP, this is the skills of effective communication, and one of them, which is empathic listening. So this empathic listening helps the doctor to build this level of trust between them and between person that reached out to them. And yet again, they're helping to listen to and how to get in depth of the problem that the person is reaching out to them with, because in the practice of every doctor, you're usually seeing these patients that are coming to them all the time from years and years, and they're coming there and continue to come, and so they're being treated, but there's no result. And then when a doctor is starting to use this technique of empathic listening, they're finally starting to more in depth get into what is the reason of reaching out, and provide better care for them. So separately, there is a story on psychoeducation, because psychoeducation is the instrument that the medical worker is achieving during training, and the fact that they're using during the talk with people when they're reaching out to. So what does psychoeducation give you? They're allowing doctors to explain with simple words to a patient, especially if there's any kind of needs in mental health services, what is really happening, to help that person to destigmatize oneself, to help that person to explain, and then to how to get the control back on what is happening with that person. And the last thing, I see that the time is almost up. It's just an important question, which is destigmatization. And the best thing forward, we can see this was the people with dependencies, as alcohol dependence and dependence from other psychoactive. Because before this topic, and people who were reaching out or had a dependency, doctors were usually avoiding them or ignoring them, this aspect of treatment. And so after training on GAMH gap, that what we are hearing during supervision, this is the the doctors are starting to see not the dependency, but starting to see a human being behind the dependency. And this allows them to, in the same way, to dig deeper and then to understand and select the techniques to help the person to deal with it. In continuation of our talk, I would like to get the microphone to Oris Tsubo, who is not in just our place, in the few places. He is the psychiatrist. He is the executive director of the Institute for Psychiatry Institute of Ukrainian Catholic University, and also is a manager, a leading manager of Ukrainian Swiss project, and then a trainer and a supervisor of MHGAP. Orest is the one who made me trust to MHGAP. I'm going back to the future. I remember it was 2017 and 2018. We were going in the intercity, and 2021 no. No, you're misleading. You're misleading. No, it wasn't 2021. So a Lviv person is going after the meeting with the Ministry of Health. The head is up, and the tickets are getting us together. And so I'm thinking of something. So I know Horace for many years, and then so I'm sleeping, and he's there and starts to tell me about the MH gap. He opens the laptop. There's a video that he's showing, and I really got an interest in him, saying that this is a great thing. So how a doctor is leading the admissions and so on and so forth, and then so on and so forth. And then in 2021, we've thought, or 2022, we really thought about the how to launch MH gap in online course, and we understood that simply so that everybody would stand up, and people are not going to do that. And so every one of us, it requires motivation, moral, material, but just so that there's a look at that motivation's there. Therefore, for many things, we've thought for ourselves, and among those things, as far as you remember, if you're in the topic, the package of national services, number 51, and then there was testing and discussion, a focus group as well of doctors of family medicine that I've been in contact for a long time, and testing some of our fantastic idea on the fact that somebody who has been really against that, but the process has started, and I'm grateful to all the team that started to participate in an online course, and I thank all of my colleagues who have been here. This is the great line of work, and then in the management and the partnership that is referring to the offline training, which is 21 partners, and so we've signed a memorandum of understanding, and so the MH4U as some of the other partnership that played a great role here. So here I would just really like from Orest in the audience to hear the opinions on the competency is also the knowledge and how to work in a multidisciplinary team. We don't know how to do that, and we were not really taught to do that. The training and intervention of WHO, there in many ways, and the work in the team and rehabilitation is setting us to the team and multidisciplinarity, and we've talked about that. And so how this gives you an ability, the teams that give you training, so what does it give them? And I'm just also like to hear, how does the role change of the medical workers and the mental health, and in general, does the workforce ideas change that not just went for training and then believed and trusted and started to be as us the followers of MHGAP? Well, thank you so much, Irina. Thank you for the invitation, because MHGAP, this is also my personal story, and Irina, I remember that this is our moment of interaction. This is such a case for the advocacy. When you're using any kind of moment and talking with the politician just to show how something, it's just like in the sect, right? But in 2018, when I had the international on the human rights, FAMI has opened it up for me, and I wanted to translate it into Ukrainian, but it was 2017 and 2018. I don't remember. NHSU reform, a new structure completely formed. The primary care started to become a real thing, and in a year, Alisa, and I'm so grateful to her, and WHO started to use this instrument, started to translate this instrument in 2019. In February, there's been a first group of trainers, and I was able to get there together with Igor Zastavny, with Anastasia and others. It was a great groups of experts gathered there, and it was important when we are starting to do something to start from the great people and great time, and so we started to proofread this instrument. So I'm grateful that I was also involved to the proofreading, because I think to the doctor there has to be a quality instrument, and because you all know the doctors are busy, they're skeptical, so all those things, and the instrument has to be good, but in bad interpretation, and then this is losing a lot of ground. And so all of those basic things have gathered together to one point. In 2019, we've started the project on mental health for Ukraine, when we take into account the component of primary care that just started off of at that time, because we worked with a Mahila Academy, and then in Lviv region there was a great example of primary care, which is Червоноград, but now Sheptetsky Center for Primary Medical Care. And I'm grateful to Anna Yermova that has also reached out to that on that experiment. And so here an interesting thing is in that we involved from the community, the first trainer and the social workers and psychiatrists, from family doctor, and then the first thing that we found out that those people didn't know each other. So this was about the multidisciplinarity in real life. And so the patient did not get this referral or interaction. This is the first insight that we understood from that moment onward. But then those things have started, and I'm in full support of Irina by saying that the initiative of the First Lady and all those movements, they've given us a big push forward, and the online courses of great quality. And this is a great product that Ukraine can be proud of, even though we are continuing to follow the training. And I'm grateful to Organization Academy of Family Medicine, and also for jointly continuing to do that. And so here, this is an interesting thing about the competencies. This is the knowledge, skills, and attitude. And so here we need to think a lot so that the attitude would change, because there's many things that are happening, especially in family medicine. This is the complex conditions of work, big load, not fulfillment of any basic needs, and those are also the things that we just need to try to satisfy for people, because image gap, as the practice shows, this is also about mental health of the doctor, of the personnel, of their families, and what we saw in the process, to what extent it helps us to solve complex matters that have not been solved before, chronic conditions, complex patients. And so here we start to have the understanding that the doctor cannot fulfill it themselves. Not the doctor, not a psychiatrist. This is what leads us to this multidisciplinarity and the importance of this referral that we remembered about today in the first presentation, and what kind of support to be gotten. But this might be simplifying your line of work and to respond to the issues that the patients are having. So MHGAP, this is just an entry point of mental health, and I am grateful to everybody involved. This is the great line of work to a great number of people of the national level and the local levels as well, for it to actually work. We would still need to work on it to be easy to understand. There's many promotional line of work that is needed, depending on what was done, because there's still skeptics and we are losing ground because of that. To explain the importance of this instrument and not just teaching psychiatry and family doctors, there was a fear of from the psychiatrists that, a portion of their work will be taken. The family doctors were thinking that psychiatry is being given to them, but there's still a lot of explaining to do, and a lot of the things, even though we did a good online course, a good instrument, and so a good story from the numbers that we've shown. Therefore, I wish you all to have a good health, because we would need to even more work to be done, because MHGAP is showing us how many more needs are not covered and that we still need to work all together. Thank you so much.
Thank you, Orest. And as a moderator, I will allow myself to comment on a different matter. The primary healthcare and MHGAP MHGAP trainings gave us new opportunities, but also presented us with different challenges. I mean that the healthcare system should be a holistic system. There are multiple health providers, a lot of issues because people reach out to receive health care. The next step was to expand the network of mental health centers. Before, we conducted trainings for multidisciplinary mental health teams. So there were a lot of activities that were implemented starting off from 2021. And last week I was delivering a lecture in the Kyiv Mohila Academy, and the young people did not know anything about the post-Soviet era, and that is great because we are talking about evidence-based practices, and we contribute to the effort to make them even more effective. The primary health care providers are already competent, and now we strengthen their capacity. We expand the mental health network. The multidisciplinarity is the basis of all of that. But getting back to the fact that primary healthcare, specialized healthcare, and also specialists working in healthcare, particularly in the field of mental health, need constant recovery. They need prevention of burnout. And, giving the floor to our next speaker, to our next colleague, Anna Sayenka, who works in the Ukrainian Foundation for Public Health, and they also represent the organization Health Right International. Your organization has a wealth of experience of integrating mental health services into the primary health care. You've been working in different difficult regions like Kherson and Kharkiv regions. This model is really great. I would like to hear more about your reflections, your pieces of advice, and how such programs can serve as a tool for recovery, for professional growth. You have been working a lot in this field, so could you please share with us what you have managed to achieve? Thank you very much, Irena, for the question, and thank you very much for having us here. Speaking of trainings and interventions that we are talking about today, I will repeat myself, but I do understand that it shows that our joint work proves to be effective when a lot of people are talking about what is happening and how it improves the life of mental health specialists. In our public foundation, Health Right International, trainings are no longer some protocols or something like that. We consider the process of training in a more comprehensive way because, the mental health specialists are the first responders here, and taking into consideration that we are working under the strain of the war, we face chronic stress, emotional fatigue, and when we say that they have a chance to attend any offline training because it proves to be the most effective, we do understand that for them it's a chance to get a second wind, to shift their attention to something different, to get inspired, to talk to their colleagues, and at the same time enhance their professional capacity. For them it is really important. People come and say, we did not get a chance to talk and people did not hear to us before. We were in our professional bubble, and when we give them new tools, we introduce new interventions, they consider it as a second wind. when we are talking about interventions related to MH gap, self-help plus, and our intervention caring for carers, it is important to know that they can use such interventions to take care of themselves. Those centers that you have already mentioned, they cover this training, and when working at the level of the primary healthcare and providing services to the people, reaching out to them, also provide support and care to the healthcare professionals in that primary healthcare facility. They conduct different relaxation sessions for them. It is really important to find 10-15 minutes for doctors to just talk to someone, have a break, grab coffee or tea, and just discuss something that troubles them or bothers them, both personally and professionally. And another great tool is supervisions that follow these supervisions. And these supervisions allow people to discuss different professional matters and to prevent burnout, because we do understand that burnout is an issue that should be worked on, that should be emphasized. That is why supervisions help our specialists to find that external support, to share their challenges and struggles. Another important point is that when we are talking about different trainings, especially if these are multi-sectoral trainings or inter-regional trainings, our members, they form their practice community where they can discuss really important matters, again, have support, and find the solution to the challenges they face. We are extremely grateful to you and to the Coordination Center and to the program of the First Lady How Are You for the fact that we can together do our work better and support the first line professionals. Thank you very much. You underlining the support for first line responders is really important, because this allows us to be resourceful to help others who need our need. Also, to add to your words, the Ministry of Healthcare, in cooperation with the World Bank within HIL project, is developing the mental care spaces. There will be 60 of them in each region. There will be a few of them, but this is a model on how the communities can support mental health centers and the specialists from those centers. And we are moving forward. I would like to give the floor to it's a conversation, a dialogue, not a discussion, but I would like to give the floor to Yuri Sich. He is a family doctor, the deputy head of the Inter-Family Clinic, the PhD family medicine in the National Medical University, trainer and supervisor in MH Gap. Let's give him a round of applause. We decided to invite the representative from the private branch, and in Ukraine 40% of primary healthcare providers account for private ownership, which testifies to the financial capacity. And that was a bit of a tangent. So now I would like to mention that you work daily with patients, not with patients, but with people. I do not like to say that family doctors work with patients, but of course you work with patients, and you train those who provide support to your colleagues. So I am wondering, judging from your experience, how does self-care, affects the services provided to the patients. Thank you very much, Reina. You know, I got inspired by all your stories during the previous panel discussions. I thought that I would be very concise, but not now. So I would like to share this story of opening our clinic. I remember when we were creating our volunteer team, and you know, when people were coming by trains to our railway in Uzhhorod, those people were standing on their feet during 3 days because they couldn't get to the right location because there were no empty places, and young people, they had some health struggles, and we faced such an issue, you know, that at the university we were not prepared for the war, and none of us was prepared for that. I think that you remember the lectures during the classes. When we, you know, write something down, then we do some hands-on experience, and then we recite some lectures. I cannot say that we were taught such things as self-help or stress management techniques. A few words were said about this at university, but when we faced such matters at the railway station, we realized that there was a gap somewhere. And when I first heard about the MH gap, about the flagship program, I do agree with all your words, because when I first ended up at the training and we started working in small groups, big groups, discussing some things, we were asked different questions. It was extremely useful. Such a format allows to gain those skills. You know, during the course of 4 days, you can really enhance your knowledge and skills when it comes to PTSD, depression, acute stress, grief. And we do understand that these diagnoses are commonplace now, and their number will be increasing. Responding to your question, I would like to say that my own well-being is a major value for me, because the more resourceful I am, the more I will be able to provide support to people. You know, I often recall the instruction of the oxygen mask. I'm sure that you have heard about that, and it's about the fact that when you want to support and provide help to others, you should take care of yourself first. You need to create this third additional room for those things that you like, those that inspire you, that make you more resourceful, because working as a doctor drains your resources, and MH Gap provides you with plentiful tools to any taste. I know that my time is up, but I would like to share one short story. I promised my supervisors that, and they say that, you know, once I tried breathing techniques, and I thought that I would choke. And you know, MH Gap offers different tools, and these tools are good for someone, others do not work for someone. For example, as behavioral activation, active relaxation, mindfulness techniques that were greatly described during panel discussion, and this is about the fact that the person should live in the present, not in the future or in the past. We also teach people some positive coping strategies like walks, sports, swimming. As for me, I adore breathing exercises. I love teaching them to the participants. You know, sometimes they take them in a skeptical way, like, I'm like breathing all the time and how will it help me? You know, I wouldn't be able to explain to them how to do them if I didn't try it myself. Also, it was also important for me that I have a team, and in our clinic we use the tactic of meetings which are informal, where you can explain or express your ideas, your thoughts, what troubles you, what bothers you. We even have a validated form in Google where doctors are able to share their challenges, issues they face, and this really brings us closer. When we have such informal meetings, it helps us to support each other and get more resourceful even at the workplace. Thank you. Thank you very much. Thank you very much, dear colleague. And the next speaker is Olena Kolodenko, one of our leading experts in the field of family medicine, the person that shares our ideas in the development of family medicine. She is the director of the primary healthcare facility in the city of Odessa. She's the family doctor. She is the doctor in medical sciences. She's also the training in MH gap. Olena, I have a very simple question, but I would like to hear the candid answer. How do your clients, your colleagues like working with MH gap? How do you manage to strike a balance between education, work, and your mental well-being? You know, we always talk about this, but we do not always impact the conditions that our healthcare workers work in, and it does not really matter whether it's in the east, in the south, in the center of Kyiv, or in more in safer areas. But Yuri mentioned that there is still an influx of the people evacuated. I would like to extend my gratitude to all the specialists who support these people. There are our colleagues who have contributed a lot, and we are equally grateful to everyone because everyone works in difficult conditions. But how to strike this balance after sharing your issues? Thank you very much, Irena. Thank you for having me in this panel discussion, for your question, because it is really important. We often talk about trainings, competences, but less often about the conditions in which we can put to use these competences. And the knowledge gained by anyone at any training can be implemented only in the environment with trust, fair relationship, mutual understanding. And if all of this does not exist, there will be no implementation of knowledge. This will be just another lecture delivered, when you just listen to it and then you forget it right as the conference is over. That is why it's really important to have that conducive environment where this knowledge will turn into self-development, into helping others, our colleagues, patients. I mean, shaping the culture in grassroots level is crucial. As the director of the center and as the WHO image gap trainer, I can see that new knowledge is a key to changes, but you need to know how to use this key properly. The uniqueness of the MH Gap program is that it does not only provide you with the tools, but also with the skills on how to use these tools, which is vital. The most important thing is that it provides knowledge that allow to view a person as a person, not their symptoms or diagnosis, to view a person in a comprehensive way. It is important, very important. I would like to say that when we started implementing the MH Gap program, our family doctors were apprehensive, were not very responsive, receptive, and it is of course tied to the fact that family doctors are stretched too thin now, especially after COVID times, after that break of the full-scale invasion. They were overloaded, and when we said that they would be gaining new competences, of course they resisted. And honestly, when I faced the same and saw the training program, I did realize that we will be scaling it up, and I was a bit skeptical because I did realize that yes, family doctors, they are a small part of it, but there are a lot of other specialists who have to be engaged into the implementation of this program. And today it is a pleasure to see the police force, the emergency service of Ukraine. We work together and we speak the same language. We do understand each other. We complement each other, and we are talking about the things that we share or the ones that are really painful. For me, it was a major challenge when we started implementing the MHGAP program in universities and started delivering lectures, trainings to the educators in universities. But we survived. Can you give us the slide back or the next one? Okay, let's carry on. But we weathered that storm, and it was very pleasant to hear is that the educators started sharing their stories for the first time. They owned it up to themselves that they might experience professional burnout, and we started discussing when it is necessary to implement the program, during which year, within which discipline. But it was a pleasure to understand that everyone shared the opinion that it was a necessary step and something that will turn it into a stable process. Going back to our center, what also inspires us and gives us an opportunity to work with MHGAP implementation is cooperation with civil society organizations. We work with different colleagues. For example, thanks to the FHI 360, we have an in-house psychologist who works not only with our patients, but even more with our specialists, I mean all the healthcare workers, receptionists, janitors, doctors, and it is a pleasure because it brings us closer and allows us to understand that we are not left alone with our problems, and that people they might have similar challenges, and we support each other. And greetings in our center is not only hello but also how are you. How are you doing? This is an open question. We already know that the answer is not yes or no. This allows a person to understand that someone needs support. Such cases, they do provide you inspiration, they do enable you to support each other, and everyone understands that everyone can experience burnout, and you should not be ashamed to talk about this. And if someone got tired and asks, can I leave work earlier today, I say, of course, if you are done you can leave. And you do understand that you can, it is really great to do your work like at 100%, but you will only have great results when a person is resourceful. And
if we speak about the development of mental health, I'd like to say that training, practice, and teamwork, this is something that'll make this process sustainable. It is so important for the humanity to be the foundation of all of that, humanity of each person and the humanity towards each other. Thank you so much. And the topic of mental health, apart from everything, has to include dignity. Every person, every worker in the area, in the state in general, like in mental health, dignity is the priority of all the priorities. I remember well our meetings, with the family doctors, how it went, and we have so many comments until now in the social media that we were forced to do something. But MH gap is irreversible process, and it is the integral component of first aid, and in the program of medical guarantees the first package is also primary health care in this field. But it shows the sustainability in all the policies of mental health, and the state truly guarantees the provision of the psychological first aid on the primary health care level, including it into the package of primary health care funded by the state budget. And moving on to the end of our panel discussion, it was our conscious decision to leave for the end the representative of the higher school, the professor, doctor of medical sciences, prorector of my native Lviv University, endocrinologist Victoria Serhienko. So, for some reason, the slide disappeared very quickly, but we showed you that slide. Well, it wasn't prepared exclusively for today, but it shows how we work jointly with the WHO, partner organizations, our international partners, of course, Ministry of Health, how we work on the integration of MHGAP program into the training curricula of higher educational institutions, medical universities, very fast, with the support of the UNICEF. Will integrate MHGAP into the curricula of medical colleges for the nurses. This is a very complex process. Trust me, it was a cultural shock. I confirm what Elena said for the educators of the medical universities. It was a huge shock that they have to finish MHGAP training. What is it all for? Why psychiatrists use one rationale and family doctors the other one? But gradually the rectors finished MH gap training. We had meetings with them, motivating them with the participation of the minister as well. We had discussions, and in the second meeting, my colleagues of mental health, they had light form of panic, and they said, will it be just as passionate as the first time? But this time it was so like in a family. We communicated very well with the rectors and representatives of higher educational medical universities. MHGAP is all about the changes of approaches to education from the ordinary traditional system where we studied and continue studying all the way up to the modern, innovative educational methods. And after this long prologue, as communication experts say, I'd like to ask you, Victoria, as a doctor and as a scholar, a scientist, a manager of the higher medical educational school, in your opinion, mental health education, did it impact you personally? Did you have some changes, maybe some turning points in the attitude? And how does it cover the work of the university and the work with staff? Besides Lviv National University, Advertising Commercial Moment has a pilot flagship project, University Hospital Experimental Project, and the university is highly responsible for the creation of this modern, high-profile university hospital based on all the pillars of mental health. Thank you so much for the introduction. It's difficult to add something to what you've said, but big projects, global changes require stress resilience. Let me start from the beginning. Endocrinologist. We all understand well that if we're not empathetic, we were trained that way, if we don't open and impact our patient emotionally, the patient won't open to us, then we won't have the support and compliance and adherence to the treatment. But if you're the endocrinologist working with patients with diabetes, chronic diseases, for example, if they come to you, then to somebody else, then come to you again, you'll communicate with them for many years. And my favorite phrase has always been about diabetes, that diabetes is not a disease, this is the lifestyle. And it's like driving a car in the mountains. Of course, you may know the traffic rules, but if you don't use them, you won't be able to save the life. So this is about the ability to use the information we have. The empathy is the foundation of training. That's a part of our soul. But how to train the educators and to say that this system needs to be changed? And why is that? Because we educate students on modern protocols, and they have some baseline knowledge which is more or less the same. But for some it works, and some have this good approach to patients, others don't have that. Somebody cannot even approach the person who doesn't want to answer the question like, so what bothers you, what brings you in? So this approach needs to be changed. And being not in very comfortable conditions when everything changes very fast, of course, due to the management, we have the young rector in the picture. You can see him, and he finished also this training. And this training, it became a part of dogma. MH-gap elements were a part of the pre-degree level. We're speaking about the specialists preparation, and they were implemented on postgraduate level, where we prepare the specialists of the general profile, and during the specialization, the secondary preparation, and the element of postgraduate degree, because we understand that people can work in the scientific field in different areas, so we provided them with this opportunity. So for sure we can say that there will be no person who hasn't received the information on how to work in crisis and how to support a patient and how to take care of yourself when you do need this support as well. Of course, we would not have made it without our partners. Thanks to the WHO MH Gap training and Ukraine Swiss project where we had training of trainers, we know how not easy it was, how difficult it was. And I want to thank my partners. Let me share my brief story. The Center for Prevention of Diseases of the Ministry of Health, Natalia Timko. I came with her for the first time in the training. Back then, Tetiana Ivanchenko. Ivanchenko Timko. Well, back then I didn't really understand why I needed that training, but it gave us strong communication. After that, we signed the tripartite memorandum between our University Center for Disease Control and the University of the Resilience. Like, we have the multidisciplinary team, which is not purely medical. It includes different specialists, and they work together. So we started polishing off different horrible scenarios, how to respond to rocket attacks, how to coordinate care on pre-hospital, hospital level, how our rescuers have to respond. We truly appreciate that how psychologists have to work and self-help kit, and we engaged our students into the process, and this way we showed that this type of interaction has to be gradually and consecutively implemented. The next point, the University of Resilience and Safety started the idea of the creation of the training on biosafety and biosecurity. It all started from this cooperation that is so important these days. That's why, speaking about how to support patient, it's all about empathy. It's all about not losing ourselves. Of course, it's difficult. We'll see a lot of people or situations that not everyone will like. And let's be honest, we also don't like everything about this century, but we have to keep going and defend our front line. In this case, it is very, very difficult. It's educational, treatment, and scientific front line. Thank you so much. Let's applaud to Victoria. Actually, today we can confidently state that MHGAP has become a sustainable part of our daily lives of the healthcare workers of primary healthcare level, and out of 18 universities, 15 are under MOH. There are only 15 of them, and 3 of them Kharkiv, Karazina, Sumy State University, and Uzhhorod National University. All of them practice on pre- and postgraduate levels, implement an MHGAP program that is helpful, and it's all about sustainability and quality. We are following the timelines very strictly, but we'll take 3 more minutes. And the Blitz questionnaire. As optimists in this life, and the country is an optimist itself, let's imagine in 5 years we meet in the traditional 8th mental health forum. All of us are very, very experienced mental health specialists. Half of the world is here exploring our experience. So how would you see the mental health specialist in 5 years? What would you like to see in 5 years? What should the mental health specialist look like and be like? Professor? Whoa. What a question. Mental health specialist has to have high quality training and preparation. If we can see that the person is certified or has a degree, we should understand that a patient or a client or anyone asking for help should be able to trust this specialist and not worry, as they earlier said, that that specialist bought a degree. There has to be trust to the representatives of mental health field. To do that, we actually need to implement in this quality monitoring system and in the area of competencies on both pre- and post-graduate level, and in the system of continuous professional development, we have to integrate the quality monitoring in all these levels, we get new competencies or make more profound the old ones. And the regulatory acts will help us, which will be released soon and related to the mental health law, of course, because it'll be all about certification, test attestation, and the continuous professional development points will cover not only the healthcare workers. I want to thank the professionals from other areas who agreed to join this system. Of course, we cannot fit everything into the educational curricula on pre-graduate level, but we can develop via the system of continuous professional development and strengthen the quality. Actually, I said that after the trainings, after education, we can see the development of professionals. We can see their changes. In 5 years, I'd like to imagine that there will be even more specialists. All specialists will have all the necessary knowledge, skills, and competencies. They have different attitude. They use evidence-based support methods. They are human-centered, and they do not stigmatize neither themselves nor others. I want to see more and more specialists like that. And the key point for the healthcare workers to take care of not just their patients, but to have the habit to take care of themselves and their colleagues. Thank you. Thank you. It's not an easy question. I support what colleagues have said. I want to see the specialist who knows what needs to be done and is interested in the needs of this specific patient. It's important to say that this should be the specialist who feels passionate about his or her job and is not trying to find some other job, can meet all the basic needs, is flexible about the choice, and is trusted, and due to good education, knowledge, and the regulatory framework regulates capacity and responsibility, this specialist is trusted. Whatever he or she says is perceived as the competent opinion. We're aspiring for perfection. In terms of the specialists in 5 years, they are humane, because it means that people will come for help to them. They are professional. They have modern tools. They aren't scared to develop and systematically develop. They aren't scared of teamwork, because each and every one of us are superheroes, but when there are a lot of us, we can overcome anything. And this person has critical thinking. It's an important skill that'll help respond with empathy and resilience. It's important for the person to believe in himself or herself and take care of herself or himself, because you gotta put the mask on yourself first, and it's an important rule for nowadays and in 5 years, and the person should feel free to come for help. Thank you. In 5 years. I think that this is a specialist, sorry? In 5 years. So it's a specialist who's been through MHGAP training on pre-graduate level. I hope it'll be integrated into the curricula. And if it's a specialist from colleges, it'll be great as well. It's a specialist who gets supervisions. Sustainable supervisions, constant supervisions. It's not just the short-term supervision after the training or education. It's a long-term supervisory support from the mentor or more experienced colleague. It's also a person who can quickly, like in 5 years, I have no idea what the pace of life will be like with the AI development. So it's a person who is not lost in the flow of information, who can fast differentiate the evidence-based information or the trash information. That's why I'm absolutely sure that the specialists develop with the rocket speed, and it is visible. We'll see in 5 years. Sure, we'll meet and see. It is very difficult to speak after like-minded people when you heard everything you dream about. I want the specialists not just to have the competencies and skills, but to be able to use them as well. It is so important to truly be a specialist. I'd like for family doctors or GPs not to be scared about the discussion about mental health, so that it would be a natural process, so that they'd know how to provide care to people who need that. I'd like to see family doctors being open for a dialogue, so that patients would have a chance to open up to them and to have the full care necessary. Let me repeat and say that both family doctors and healthcare workers have to take care of themselves, have to rest, have to be resourceful to be able to support others. Thank you. And I have a very difficult task to sum everything up. So it's an educated person who knows modern protocols but wants to develop. And it's a person who is quite empathetic, but the one who can have inner boundaries, because this empathy shouldn't hurt you. This is a team player, or the person who has access to the team and knows who he or she can communicate with if needed. And this is a person who works, who has and who is able to apply time management. This person has free time, just like we do it here. Of course, we're dreaming here, aren't we? And in 5 years, this person is protected. It's a specialist who has protection and feels this protection from the state. Thank you, Victoria. As an experienced expert, I'll also dream and share it with you. I want in 5 years in this room to meet, not only here in our institutions, not just healthcare facilities, all the area providing services in the mental health field. I want our specialists to be satisfied with their work, so that their work would be valued, prestige, and needed by the state, so that they wouldn't be careless, which is important. But what's more important, I want all of us to meet in 5 years in free, independent, and wealthy state. Thank you. I want to thank colleagues. I want to thank all the participants of our big panel. I want to thank our live happy audience, everyone who listened to us. Let's applaud, and with Serhiy, we'll keep on working a bit. So the work, which was about MHGAP component, was tremendous, multidimensional. We engaged a lot of our partners. The memorandum was signed back in 2021. The Ministry of Health, the World Health Organization, 21 partners joined the work in this regard. Some partners disappeared because there are some changes in the US policy, state policy, but we do remember the contribution of USAID into this work and plan, and taking advantage of this great opportunity of this inspiring audience, both online and offline. We want to thank and say a few good words about the partners who contributed the most to educate and train our specialists. We are absolutely sure that we'll continue working for many years in MHGAP context and in the area of mental health center development, because we've signed the declaration about the engagement of the partners in training of specialists on the standardized program, and of course in the area of other competencies. We have so much work ahead of us. So today we'd like to give the thank you certificate FHI 360, Ivan Malik, Coordinator of Programs on Mental Health. So the gratitude certificate for the contribution on behalf of the Ministry of Health. Please stay here with us. We'll all wait and stay here. Yeah, IMC, Yulia Ohmat, the coordinator of mental health programs and psychosocial support programs. The gratitude from the Ministry of Health goes to Vladimir Korostyuy, the coordinator of mental health and psychosocial support programs, Doctors of the World, Greece. Or MDM. So, one more important organization from MDM of Spain, Julia Melnik, the coordinator of mental health and psychosocial support programs. Orest Suvalo, Ukraine-Swiss project Mental Health for Ukraine. Representing Ukraine-Swiss project Mental Health for Ukraine, MH for you. And today, the UNICEF representative Anne Levens, health programs and nutrition programs. She was here just next to me. So we'll send it to her by email. Colleagues, we want to thank you on behalf of our panel. I want to thank all the specialists working with us in this field. Let's have a picture. Thank you, Irina. Congratulations to everyone who received the awards. Thank you for the high spirit at the end of the working day. Do not leave. This is not the end. I can see that a lot of people are leaving. Do not run away. We need you. Not for long. Thank you. Thank you. So actually, it seems to me that we worked hard today. And if you support what I'm saying, applaud. Thank you. So we're gradually finishing the first working day of our forum, the third forum of mental health. We've heard a lot of opinions, a lot of interesting cases, and a lot of ideas, insights, and visions. So we have to sum it all up. To sum up the first day, so I'd like to invite Dr. Fami Khanna. Please applaud the expert of mental health of the headquarters of the WHO in Geneva to officially sum up the first day and for the final words.
Good afternoon, everyone. Wow, we have almost a full room. I was asking the colleagues at the registration desk, how many do we have in the room? They told me around 300 plus, and I can see not many people has left. I want to tell you, I'm actually doing this job for the last couple of decades, working on mental health and emergencies. Perhaps I cannot count how many countries I worked at, 30 plus, 35 plus. What I'm seeing now for colleagues working in a shelter with electricity get interrupted, in the middle of war, 300 people from all around the country discussing how to improve the quality of their own country mental health services is quite inspiring for me. Thanks to all of you. This is remarkable, really. Ukraine is unique in many things. I mean, the image gap program we saw today is one of the biggest in the world. The coordination you established, let me give you one concrete example with figures. The world's biggest coordination group for mental health was in Haiti back in 2010 after the earthquake. That was 110 organizations. You are working with 250 plus. You are double the world's biggest group in history. And you managed to make sense out of it. You localize the response. You build cadres not only at the oblast level, but at Triomas level, which is really, really, really unique and inspiring. You turned, I think, the Ukraine success is that you turned coordination into a community. There is a community across a huge country that actually collaborate on mental health and psychosocial support. In today's humanitarian field, where there are questioning what is life-saving and what is not, where people are saying the priority is food, water, and shelter. But you are aware that humans don't live only with food, shelter, and water. It is, as the First Lady of Ukraine has kindly said, it is about being human in inhuman situation. Food and water can make you alive. Mental health can make you live. A program like How Are You, its true essence, its real success, not only in creating a community, and Ulina, our colleague from Odessa, you kindly mentioned that the team in the center was asking one another, how are you, every day, making a community and making not feeling okay and access to help actually okay. The true essence of the program is sending a message that how are you, the specific individual, the one person in Ukraine, is a national priority, your well-being of every single individual. Multi-sectoriality, you brought it to practice. I mean, I'm coming to Ukraine, I think, since 2014 on missions. And I know there are a number of leaders in every sector. But today, I saw many leaders, from Ministry of Health to Social Affairs to Coordination Center to veterans to police, and I can go on with the list. There are leaders in every sector, and that brings multi-sectoriality, that mental health and psychosocial support is not a matter only for specialists, whose role is very important, but for the whole community. I saw that coming to in practice today. I saw also the message of the importance of capacity building, that we should not only invest in building the buildings that were destroyed, but we should prioritize investing in building the people capacity who will build the buildings and continue building the community. A message I'm coming out of today with is that supply chains can save lives in emergencies, but support chains of peer support can save teams. And that's what is needed for every facility and every component of the All-Ukrainian Mental Health Program. I thank all of you, thank the Coordination Center and its leadership that makes this possible. I thank every contributor to All-Ukrainian Mental Health Program. I thank my good colleagues in WHO country office here in Ukraine who made all efforts possible to make this event success, and every partner of this All-Ukrainian Mental Health Program a great success, and today a successful and inspiring day and evening. And we are not done. Tomorrow we have a great day where we will learn about many of the innovations, and we see innovations in various sectors at the marketplace. So please rest well, and please come tomorrow, and we continue this exciting 2 days. Thanks, everyone.
Фамі дякуємо.
Thank you very much, Fami. You know, dear ladies and gentlemen, while I was listening to Fami's speech, I was looking at you and I noticed one tendency. You know, at the very beginning, you were energized, smiling, and you are so even now after such a lasting, saturated work day, and that is the result of everyone. Thank you very much for this day. Let this fire and sparkle in your eyes shine forever. You know, Irena said that in 5 years she envisages the country in a certain way, and we do hope that this time comes even faster. We have a lot to do, so glory to Ukraine. That's it for today, and we will see each other tomorrow. With some of you, we've been seeing each other for 4 times, so thank you very much.